Good morning and welcome to the July 12th regular meeting of the Board of County Commissioners. Welcome to those of you all present in Harris Hall and those who are attending via video. Good morning, Ms. Morkowski.
Good morning.
Today we have a full complement of commissioners present, and we'll begin the meeting today with any adjustments to the agenda. I'll look to the board or to Ms. Morkowski. Any adjustments today?
No.
I see none. Do we have any emergency business to conduct?
Not.
I see none. Then we'll move directly into item 3 on the agenda today, which is public comment. And Ms. Jones, I will take public comment from those who are present in Harris Hall first, and then call upon you to cue anybody who has telephoned in or who has wired in for comment. Then we'll begin public comment. Speakers will be taken in the order in which they signed up, with people present in Harris Hall first, followed by people who are electronically attending. You'll have 3 minutes to speak. There'll be no cue or no warning as to the 3 minutes running out. So keep an eye on the clock. The clock will be running on the main screen to my left, to the audience's right. Or if you're at home, keep an eye on the clock, because there'll be no warning. After 3 minutes, the mic will be silenced, and we'll move along to the next item on the agenda. If you have any written comments that you'd like to submit, you can submit this week for next week's to be added to the public record for next week. And with that, we'll begin public comment. Today, we have one person signed up in Harris Hall, and we have simply Nicholas. Nicholas, if you just step to the mic and address the Board of County Commissioners.
Good morning. I just wanted to share my experience that I had yesterday at the Lane County Public Unhealth. I tried to comment on a supposed session, somewhat just like this, and I decided to ride my bike, and I went in and was immediately treated unfairly, treated like I was a less than person or citizen because I didn't have a facial covering on, and I didn't have any mask or face shield with me because I didn't know that that was a requirement. And I was rudely told that I had to leave. I was videotaping and was told that videotaping wasn't allowed. It's a First Amendment constitutional right. I was lied to and was threatened to have the cops called on me, which I said, fine, sure, go ahead, because I know my rights. I decided to pursue, because I had other alternative motives, which was to comment about masks and vaccines and mandates, possible mandates coming back. So I rode my bike back, and then I came back on my car with a face shield, because she told me that I had to read the sign in the front that said that face shields and masks are required. So I came back with the face shield and was treated the same exact way. And I was also told that, again, I couldn't videotape in a public space. And I was told that the cops would be called. Then with my face shield, she said that wasn't acceptable, even though it said on the sign that it was. And I've experienced this before, where one rule is a certain way and another is a certain way based upon what's said and what's written. And then I was told that there was no comment period. I was told that I was misinformed, and I said I just wanted to comment on Lane County Health and have my First Amendment rights treated fairly and lawfully, which I wasn't. I was also told that I was threatening the lives of everybody there because, you know, I'm unmasked, but yet I had a face shield on. And I just find it interesting that you guys say that you don't want discrimination. You don't want me or anybody else to discriminate what other people do, wearing a mask, going to a Saturday market without a mask when masks are required. And when is this going to end? What good does it do? The virus, supposedly the new one, is just as spreadable as measles. And they are saying that masks don't do anything. They never have done anything. So I just wanted to put that out there and say, stop discriminating. Tell the public health people to stop discriminating. We're all human beings. We all have our own choices. Thank you.
Thank you, Nicholas. That concludes the testimony for the people present in Harris Hall. Ms. Jones, do we have anyone signed up electronically to speak?
Thank you, Chair Farr. I do have, I have 10 people signed up. I'm not sure if they all would like to give public comment. If you have registered for this meeting and you wish to give public comment at this time, please raise your virtual hand and I will call you in the order the hands are raised. At this time, I see 3 hands raised. I will begin with, now more are going up. I will begin with Mike Arnold, followed by D. Love. Mike, I will unmute your microphone and you may begin your public comment.
Hi, can you guys hear me okay? Good morning. I'm Mike Arnold. I'm an Oregon attorney. I live over in Thurston and Springfield. I sent an email yesterday kind of outlining my involvement in the psychedelic space, and I wanted to make some recommendations regarding implementation of ballot measure 109 here in Lane County. So I founded Oregon's only publicly traded psychedelics company. We've done 2 psychedelic retreats here in Lane County already using ketamine as a proof of concept. They're nature-based retreats. The email I sent over has a link to the Outside Magazine article that sort of summarizes how these retreats are conducted. We also host psilocybin retreats in Jamaica. And that's kind of what I wanted to talk about, is just how these things are implemented. There's very low impact to the community. It's essentially about the same impact as a yoga retreat. Only in our particular psychedelic retreats, we do typically 2 full-blown deep dive sessions and 1 microdosing session. And the rest of the time is in group integration conversations, as well as yoga, hiking, etc. The one we did in Lane County, we rafted the McKenzie, we hiked Blue Pool, I think that's Lane County perhaps, and then did other nature-related events here. And yeah, I just wanted to be available if you guys need to know logistically how these things work. We do cultivation in Jamaica of psilocybin, and I would caution, or at least recommend, that the board not refer to the voters at this point. I don't have a dog in the fight, as we're not looking in rural Lane County actively, although I would be very interested in running a retreat here. But yeah, I just want to make sure this medicine gets out to as many people as quickly and inexpensively as possible, because it works. It's phenomenal. It's a great reboot for the brain. That's why I got involved in 2018 with this company. That's why we raised capital and went public, so we could help usher in this new paradigm. So perhaps time, manner, restrictions. It could be a referral from the board about how that rolls out. But just looking at the existing land use code, as I had when I was looking at properties earlier in Lane County, appears to adequately cover commercial activities. Whether or not there needs to be any special particular restrictions, I mean, I'm open for dialogue on that, and I can definitely give my feedback of the hypothetical risk factors. But I don't know what risk factors you guys are concerned about. I've heard some mention of law enforcement concerns. That hasn't been our experience in Jamaica. It's pretty low key, and this is available for people to try and see if they can get introspection on their life. And I'm available for questions if you guys have any in the future.
Thank you. Ms. Jones?
Oh, sorry, I had myself muted. I was talking. Thank you for your public comment, Mr. Arnold. I will now move to D. Love, followed by Harry Sanger. D, I will unmute your microphone and you may begin your public comment.
Good morning, everyone. I hope you're doing well and enjoying this lovely summer that was started with a lot of rain. Hopefully the fires won't be a problem this year. Thank you to the previous speaker for his involvement in psychedelic healing space. It's a pretty fascinating field that is showing incredible, improvable results to treat people that have deep emotional trauma. So good job for getting at the forefront of that. The reason I'm here today is because I attended yesterday the Lane County Public Health Committee meeting. I don't like going to those. I'm okay coming to these, but I don't like going to those. And I went because there was an item in the agenda saying that they will be pre-planning a community-wide vaccination initiative. And I'm like, okay, I gotta be there. And they brainstormed all kinds of ideas to essentially insert themselves further into our lives and promote these vaccines and other vaccines. Some of my notes from yesterday of what they talked about, they're especially worried about the 2-year-old age group vaccination rate, meaning that they don't see that the 2-year-old are vaccinating fast enough. They want to make all vaccines really easily accessible for all age groups, including pediatrics. There was a focus on kids. And some of the things that they were talking about doing, again, this was pre-planning, reaching out to high schools to help them with vax campaigns, kids sports. They were really interested in kids sports, fairgrounds, markets, giving incentives to people. Someone threw the idea, there's food trucks. Maybe we can give people food from the food trucks. Promoting the vaccines in food pantries, healthcare centers, family support, businesses, schools, events. They even talked about the possibility of auditing clinics and seeing if they're not pushing the vaccines, they will be identified as an opportunity to basically convince them to promote the vaccines. And more, right? And I'm thinking, oh my gosh, like we already know the vaccines exist, leave us alone, but they just want to really insert themselves into our lives more. Someone even threw the idea of putting advertisement in the utility company bills. So I'm like mind blown. So questions for Jocelyn Warren, specifically, I would love to hear back. My question for you, Jocelyn Warren, is has the county or your division ever received any monetary incentives from OHA, the state or federal government for reaching an X percentage of vaccinated people? And if so, how much? And also I want to know if they will give you new incentives for the new season. And also I want to know specifically what budget are you allocating or receiving to advertise and push these vaccines for the fall and winter? I would really appreciate a response. Thank you so much for your time and have a beautiful day.
Thank you for your public comment. Our next speaker is Harry Sanger, followed by Parag Bhatt. Mr. Sanger, I will unmute your microphone and you may begin your public comment.
All right, thank you. Thank you, County Commissioner, Board of Commissioners, and County Administrative staff for affording us this time for public comment today. I look forward to today's updates on the Holiday Farm Fire, the county response to COVID, and Measure 109. All of these items have an impact on our community, in particular the mental health crisis that has resulted from the radical transformation of our community over the past 2 years through both natural and self-inflicted causes. I'm interested in hearing your thoughts on psilocybin treatment as an unorthodox approach to improving our psychological health. Thank you to the speaker that addressed this, as well as the speakers recognizing the need for a more measured consideration of the impact of the county response to COVID and the consistent application of rules that are established. I was recently reading in the Register Guard that Johns Hopkins University data shows a total of 813,050 people in Oregon have tested positive for the coronavirus since the pandemic began, and 7,818 people have died from the disease. Based on pre-pandemic definitions, what the data really shows is that 7,818 people have died with the disease. This is an important distinction if we're focused on sharing accurate information and not disseminating disinformation. With that said, many of us have lost friends and family over the past few years and experienced loss and trauma from the pandemic response, including injuries and deaths related to the vaccine. I would like to use the rest of my public comment today to embrace a moment of silence and reflect on the troubled times we're living in, including all of the lives lost too soon for too many reasons. May we all find peace and strength to rise above this collective fear as we continue our journey through the second half of 2022.
Thank you, Mr. Sanger. Ms. Jones?
I did not see the rest of my time. I would like a minute of silence, please. I'm sorry, Chair Farr. I know that's sloppy when I'm not on video and I'm not there in person, and I appreciate your acknowledgement there. And I do hope that we have a sober discussion about what it really means to push this vaccine and what the impact of COVID really is on our community, because we've all made it this far, and I hope that we all continue in good health. Thank you.
Thank you for your public comment. We will now hear from Parag Bhatt, followed by Frank Cartwright. Mr. Bhatt, I will unmute your microphone and you may begin your public comment.
Thank you very much for allowing me the space to speak today. My name is Parag Bhatt, PhD. I'm a neuropharmacologist, and I am in charge of intake coordination as well as the pharmacology conversation for Silo Wellness Retreats. As Mike Arnold has mentioned, that we are the first Oregon publicly traded psychedelic company. We mainly operate out of Jamaica with ketamine retreats that do take place in Oregon. And I have got to say that I am very interested in hearing how 109 is going to advance, as the infrastructure for this bill is going to set the road work and the groundwork for the rest of the country. Everybody is watching what your state is doing. What I have observed as a pharmacologist and in my communications with all of our participants is that there are many individuals that are seeking help and relief from their many ailments. It is not always associated with treatment-resistant depression and strong forms of PTSD, myself included, deals with attention deficit disorders. And I have found immense relief from many like-minded individuals that have been able to gain their life back from the usage and employment of this powerful medicine that has been utilized for several centuries and millennia. I believe that in the context of the movement of cognitive evolution in our society, we are really on the precipice of how we are going to view mental health going forward. We have had many conversations about the progress of mental health and applications and interventions. And I have to say, compared to all the psychological and psychotherapeutic interventions that I have come across in my graduate and academic career, I have never seen anything as profound as what psilocybin and classical psychedelics have been able to achieve for many individuals. The overwhelming positive feedback that I have received from several participants following the successful completion of our retreats has provided immense gratification in the work that we do, the time that we put in, and sleepless nights that we have. I implore you to continue to pursue quality infrastructure for these measures, and you will bring so much relief and happiness to Oregonians. And I really hope that you all take this into account. As far as any of the risks that we may have seen, we mitigate any sort of negative impacts through our facilitators. Everybody that is involved with any of these types of retreats are highly trained for several decades. They are not just anybody that comes through. There are programs that are assigned to treat these facilitators like respected therapists, and they are skilled in their application. With the time that I have left, thank you very much for everything that you are doing to allow this conversation to take place in this space. And I see that's time the rest of my time.
Thank you for your public comment. Our next speaker is Frank Cartwright, followed by Heather Lee. Mr. Cartwright, I will unmute your microphone and you may begin your public comment.
Thank you very much. Good afternoon, everybody. I appreciate you providing a container to share my thoughts this afternoon. I'm Frank Cartwright, CEO and founder of a British-based entity called the Social Fund. We help advise institutional, private equity and family office capital markets on developing out impact funds and how they can best serve society. As of recently, I've taken on a role with Silo Wellness as head of corporate development. And what we're really interested in doing is creating an impact platform where funds who have exposure to the capital markets can provide funding for those who need it the most, and really provide a framework for people and the betterment of mental health. Thus far in the UK, we work on vulnerable adults, providing accommodation across frontline responders, veterans, and as of recently have pivoted directly into the mental health scene, as we've seen such a dramatic outpour of what's happened during the COVID-19 pandemic. My personal experience with psychedelics in my own deep dive in psychology whilst living in Hong Kong, my own personal experience is that of one of dramatic transformation and has led me on such a path to now be such an advocate of mental health. What we're really trying to do at Silo Wellness is create a regulatory framework for those to access medicine in an affordable manner in group settings whilst immersed in nature. As my two colleagues have previously pointed out, we're currently running psilocybin retreats in Jamaica in a regulatory framework and capturing all the data points with licensed professionals and therapists, creating that container for individuals to go deep and seek further mental exploration. With 109, and as my colleague previously pointed out, the world is watching how this will play out. And I actually fundamentally believe deep in my core that this will be the catalyst for mental health change. For too long, individuals have suffered in the typical manner of the SSRIs and the typical types of psycho-assisted therapy, which have been long forgotten since the 1980s, and long due is a change in the mental health sector. So with the last 50 seconds or so, what I'd really like to do is advise and say that there is a public, a private, and an institutional perspective looking at how this will play out. And I think the real key is creating a regulatory framework and a safe container for individuals to work on this medicine. It's a life-changing and a potentially society-changing operation that I believe that we're undertaking, one that is not only based on the exploration of one's own mind, but for further fulfillment of society. And, you know, the way that the COVID-19 pandemic has affected our society, particularly young people, there is no time that Oregon should look and fundamentally think about how we're going to implement this medicine in a safe framework. Thank you.
Thank you for your public comment. Our next speaker is Heather Lee, followed by Gregory Binowski. Heather, I will unmute your microphone and you may begin your public comment. Heather, I show you are.
Are we good?
Yes.
Yeah, okay. Good morning, commissioners. It's really a pleasure to be here. I'm here to speak on ballot 109 in Lane County. Just as way of background, I am a licensed clinical social worker. I'm licensed in Colorado and in Oregon, and I've been a practicing therapist in both the medical and mental health field for over 25 years. In the training that I just completed as a certified psychedelic-assisted psychotherapist, I have studied with some of the top researchers at NYU, at Johns Hopkins, and I can tell you as a therapist, mental health professional, that these medicines, these plant medicines, are making a profound difference in people's lives. The area that I'm particularly interested in, and hope as you all consider putting an infrastructure around opportunities for people to have access to these medicines, is end of life and terminal anxiety. I have worked for hospice and palliative care for many, many years. I recently had my own cancer diagnosis, a breast cancer diagnosis, and had the opportunity to see personally the impact of this plant medicine on addressing anxiety, depression, and really creating meaning making, and as a way for myself and for people with cancer and disease to really look at a deeper level of their disease. And beyond the physical, this plant medicine gives us an opportunity to really explore the psychosocial, emotional, spiritual, and energetic components of disease. So you all are in a lovely position to be able to really be looking at how to create infrastructure for these amazing new paradigms in health to be accessible to more and more people. And you're in a wonderful position to be some of the first and at the forefront of creating, opportunities for this to come to your state. And I really want to emphasize that we're looking at these are medicines, and we're looking at a therapeutic use with people such as myself, a very seasoned, licensed therapist. This is not recreational use of these drugs. This is therapeutic use of plant medicine. And I think that's a really important way to frame this. And I just really want to thank you all for your time and letting me speak to how important it is. And I hope that through, compassionate use and right to try, that plant medicine finds its way to folks who are suffering from end of life and cancer. And this can create so much hope and healing for people. So thank you so much for letting me talk and taking some of my thoughts into consideration.
Thank you for your public comment. Our next speaker is Gregory Binyowski, followed by Namrata Gandhi, and I do show Namrata Gandhi is our last speaker. So, Mr. Binyowski, I will unmute your microphone and you may begin your public comment.
Good morning, everyone, from beautiful, sunny Vancouver, Canada. I'd like to thank the Board of Commissioners for allowing me to speak today during this public comment. I am a Canadian attorney. I've worked for many years in some of the largest Canadian law firms doing primarily international legal work. And specifically, I am the independent director on the board of directors of Silo, Silo Wellness, which is a publicly traded company regulated by the Canadian Securities Exchange. My mandate on the board is, as you would expect, oversight and particularly regulatory oversight. I'm a member of the audit committee. And so I'm looking at regulatory compliance at the place of our operations. And this includes our psychedelic retreat in Jamaica. And I'm also on the advisory committee for the retreats. And so I play a role in oversight and insurance compliance, best practices, and risk mitigation. Now, I must say, I've come to the issue of psychedelics initially as a skeptic. Whenever you would hear words like magic mushrooms, I thought that's for people to kind of escape from reality. But when I did my own research and dove into the enormous amount of scientific material that's coming out right now, I've become a very strong supporter of the use of psilocybin for psychedelic-assisted therapies. Some people talk about magic mushrooms, and I would say when you look at it, actually, there's much more science than magic. If you just spend a little bit of time, you will find that some of the most prestigious research centers in Harvard, Stanford, Johns Hopkins, all of their scientists are talking about the enormous power that psychedelic substances have for mental health and wellness. And so I'm hoping that Oregon will be one of the first places in North America after Jamaica that are going to allow the use of this very, very promising natural substance to make people's lives better. Thank you for your time.
Thank you for your public comment. Our next speaker is Namrata Gandhi, and I do show that Josh Wilson has raised his hand to speak, so I will call on Namrata followed by Josh Wilson. Namrata, you may begin your public comment.
Hi everyone, my name is Namritha Gandhi. I am an event director, community director, and a holistic healer. I work with Silo Wellness and I help with their creative direction and programming. And I have felt personally affected by psilocybin and plant medicine as I have struggled with ADHD and anxiety for a large portion of my life. And I have felt the therapeutic effects of these medicines, and I feel as though everyone should experience it if they are fit to. And I feel as though when in the right therapeutic setting, they can have a very impactful benefit on the community and in society. Thank you.
Thank you for your public comment. Our next speaker is Josh Wilson. Josh, I will reset the timer to 3 minutes and you may begin your public comment.
Good morning, everyone. My name's Josh Wilson. I'm the Customer Success Manager with Silo Wellness. Just to give you a little bit of background on how we do things, our retreats are well organized to help eliminate any anxiety, fear, or hesitation with the participants, even before they get to the location. Through our registration, portal or process, we make sure that individuals know that we are tangible, ready to answer questions, eliminate some hesitation and risks that they may have heard about, whether in hearsay or just foreshadowing. But registration forms ask about medical history, current regimens, any kind of allergens, experience level. We do a one-on-one with a pharmacologist to avoid or help avoid any kind of contraindications, comorbidities, anything that would have a negative biological effect with psilocybin in the individual. When people come to us, they are hesitant, guarded, scared, more scared because they're afraid that this one potential option of hope may let them down once again, as traditional pharmaceutical or therapeutic approaches have, whether it be through their own doing or just the nature of what their considerations are. When they leave and we follow up with them on a regular basis, we hear comments like, Josh, I learned to dance again, and I'm doing it all the time. People want me to be with them. I want to be with them, and I'm not afraid to do it now. One of the things about Oregon opening up to the possibility of psilocybin as a therapeutic regimen is really profound. We have Mike Arnold, an Oregonian, as a large advocate for Oregon being first in the space to provide these services with a structured retreat process, already healing people from all over the world. It's truly an immense opportunity to help people grow. As a side note, I've been director of rehab and long-term care for the past 10 years, and the right to try would be an amazing option for some of the individuals that I work with, because they're so hesitant on moving and doing, anxious that they may breathe their last breath, that they don't have a quality of life at the end through traditional pharmaceuticals. They become inebriated or sedated, whereas psilocybin can reduce that anxiety, bring about new forms of hope, interaction, and actually allow people to have quality of life as they exit with their loved ones. Thank you all. Bye.
Thank you for your public comment. Chair Farr, we did have one more hand get raised for public comment, so I will call upon Joshua Siegel. Joshua, I will unmute your microphone and you may begin your public comment. Joshua, I do show you are self-muted.
Okay, how about now? Can you hear me? All right, great. I see a thumbs up. Appreciate that. So my name is Joshua Siegel. I'm a MD, PhD, and psychiatrist, and involved in research with rapid antidepressants. And just going to keep this brief, but say a word or two particularly about safety, because ultimately I think that's probably, the most relevant issue from a pharmacology standpoint. There's a lot of excitement about psychedelics, LSD and psilocybin in particular, as well as others, in terms of mental health applications. And there's been a number of clinical trials, large scale, even multinational clinical trials just in the last few years coming out with pretty positive results. But of course, the biggest, I guess one of the biggest things that are raised as a concern is the safety of these drugs. And you could break down safety in two ways, but the most straightforward, I should say you can break down safety in multiple ways. The most straightforward dimensions that we look at are dependence or addiction potential and lethality in terms of active dose divided by lethal dose. And classic psychedelics like LSD and psilocybin have among the lowest, it's virtually impossible to overdose on these drugs. And, if you look in comparison to many other, so caffeine has about 100 order of magnitude higher basically lethality. And alcohol has 1,000 order of magnitude higher lethality than LSD. So in terms of strictly overdosing, it's almost impossible. And in terms of addictiveness or dependence potential. Similarly, LSD and psilocybin are much lower than most legal drugs, much lower than most prescribed drugs. So they're not addictive, certainly in the physical addiction sense. That is not a phenomenon that we see. Now, I mean, there are, of course, I don't want to sound like there are no ways to abuse these drugs or ways that they are used in risky situations, but I do think it's important to point out compared to popular and legal substances that these are very safe drugs. That's all. Thanks for the time.
Thank you for your public comment. Chair Farr, at this time, I do not have anyone else signed up for public comment, so I will return the meeting to you.
Thank you, Ms. Jones, for handling the virtual queue. And I'll call for anybody else in Harris Hall who wishes to provide public testimony today. I see none. Then I'm going to do a quick time check with the board. Mr. Mokrahajski, we have a 10 a.m. time certain today. We have a couple of items on the agenda prior to that, including response and remonstrance from Board of County Commissioners. We'll try to get to our 10 o'clock time certain with the Holiday Farm fire update on time. So we'll move forward with our agenda with that in mind. I also mentioned today, Mr. Mokrahajski, is we have a pretty full agenda this morning, and we will not be reconvening subsequent to the lunch break today. So today's agenda to the board may take us into the lunch break a few minutes, or maybe more than a few minutes, in the interest of not reconvening at 1:30 today. So with that, Mr. Mokrahajski, I'm going to move down our agenda to the Board of County Commissioners. Do we have any response to public comments and or issues or remonstrances? I see none. So I'm just going to mention one thing very, very quickly. Oh, I beg your pardon.
I was waiting to give space for others.
The pause that satisfies, I guess. Vice Chair.
Oh, I'm sorry. No, go ahead.
Oh, Vice Chair Trigger, followed by Commissioner Burney.
Okay, thank you. Thank you, Chair. Sorry, a little scramble. We're a little rusty. Been down for a couple of weeks. Thank you, Chair. Thank you to all the speakers. I just want to put something on the record for clarification, a presumption of a clarification from our first speaker. I believe if the meeting he showed up to was at our Charlton building, that's a medical setting. And so that may be why the masking rules and expectations were different in that setting. I can't say for certain, but I wanted to clarify if that was in fact the case for anyone listening and watching and wondering about any inconsistencies there. And also to clarify, because I do serve as our liaison to the Public Health Advisory, and the conversation around vaccine promotion this fall was for all vaccines, which for decades and decades and decades have been protecting public health and safety for people of all ages in our community and around the world. So the conversation included, but was not specific to COVID-19 vaccination efforts in our community. Lots of really interesting and compelling comments on Measure 109, which of course is an item, so we'll talk about that later. And I think the only other thing I just can't let pass, because it is truly historic and momentous and not in a good way, is that since our last meeting, about half of the US population was stripped of its right to privacy and access to abortion, and abortion is healthcare, because the SCOTUS decision was handed down after our last meeting before we broke for a couple of down weeks. So I'm just gonna put that out there as something that is distressing and should be concerning to all of us who care about the health of our community. Thank you.
Thank you, Vice Chair Trigger. Commissioner Burney.
On a lighter note, if I may, I'm looking forward to the discussion of Measure 109. And I thank everyone that weighed in on that and spoke. I thought that was fascinating. And forgive me, but as you were speaking, and as someone who went to college in the early 70s, I was looking at our county administrator's wardrobe as we were hearing this, and with this loud blue checkerboard jacket and a pink tie, listening to talk about psilocybins, it couldn't help make me chuckle as we were about to embark on something that really is fascinating, and I look forward to the discussion. Forgive the light moment, Chair, but thank you very much.
Levity is welcome. Thank you, Commissioner Burney, excuse me. We forgive that light moment. Any further discussion from the board? Then I'll mention one thing very, very quickly, and thank you to the speakers today. We'll be discussing Measure 109 later in this meeting, and the discussion today may include, Mr. Mokryski, discussion of an ordinance, which would include a first reading next week, should we move in that direction today. That's a possibility, as I understand. So the thing that I wanted to mention is last Friday we had a celebration of a long-time Lane County employee who recently retired, Mr. Steve Manella, who was has served 43 years so far on the staff of Lane County, including his most recent years as the manager of our Human Services Division. Mr. Manella has been instrumental in so many different ways. I'm not going to go into any great depth. I may do that later because I don't have enough time to talk about Steve Manella right now. But among other things, Steve Manella was the one who brought us and brought the nation the concept of federally qualified health centers. Began right here in Lane County. It's all across America now. Mr. Manella also was the original director, the original manager of what became Food for Lane County. It was his concept that brought Food for Lane County into existence. So many other things that Mr. Manella's done throughout his career. So Mr. Mokryski, pass it along to Mr. Manella that I know we all appreciate the work that he has done for Lane County through the years. And very quickly, on a light note, I grew up in Tillamook County. I know all about the mushrooms that grew on our dairy farm, and I don't think that's exactly what we're talking about today. Not talking about people going out out on Chance Road looking for mushrooms in the cow piles and eating as many as they wanted. I think the discussion was more of a one of the later. It's a therapeutic use and not a recreational use that's been discussed. So thank you very much. Anything further from the board? Then we'll move forward, Ms. Mokryski, with our consent calendar, which will be followed by the District Attorney, Patty Perla, who is with us in the audience today, and Ms. Mokryski.
Chair, we actually have a joint meeting of the Board of Health.
Oh, I'm sorry. Forgive my rustiness once again. We do have a, excuse me, I'm going to get back to my agenda because I'm rushing the cart here. Then I will recess this meeting of the Board of County Commissioners and reconvene as the joint meeting of the Board of Health and Board of County Commissioners. And at agenda today, we have a discussion of COVID-19 response. We are reconvened as in a joint meeting of the Board of County Commissioners and the Board of Health. Mr. Mokryski, I will pass it along to you to introduce your panel. Thank you.
Thank you, Chair. And Eve Gray, our Director of Health and Human Services, is here, as well as additional staff from Public Health. So I'll turn it over to you.
Yes. Hello, good morning. And I will turn it over to, we are very fortunate to have both Dr. Ludke and Dr. Guzman here with us today to present on the current updates on COVID-19, as well as an update on monkeypox in Lane County.
Good morning, Chair Farr. Thank you. Thank you, Eve, as well. Can commissioners, sounds like the microphone is on. Wonderful. We have two updates today. The first is a COVID update, and the second will be a monkeypox update. And normally for the COVID update, of course, Dr. Warren would be here. Unfortunately, she is ill. I want to thank her for her infection control and not being here, and also thank her for the work on these slides and helping put them together. Much appreciated. So just a handful of slides for you today. This is our epidemic curve. You've seen versions of this over the months, and you can see that the numbers can continue to rise a bit. I have labeled each of the main peaks, and I'll just go over them briefly. On the x-axis, you can see the dates. Our first case in Lane County was on March 1st of 2020. You all remember that, as I do as well. And that was the parental strain, the Wuhan strain. And we smoldered for a little bit, and then we had the so-called California variants, and those were the epsilon variants, and that was late in 2020, early 2021. We had a bit of a pause. Then we had the Alpha variant, very short-lived, just a couple months, April and May of 2021. And then we had a pause, and then we had that big surprise, a big respiratory outbreak in the summer months, which doesn't occur very often in North America. And that began in late July, and we all lived through that. One of the interesting things about the Delta wave was that you can see how slow it decayed, 5, 6, 8% per week drop in cases over time. And compare that to the next, the BA1 Omicron in January, February, much like a skyscraper in New York City, up really, really fast and down really, really fast. So very different. And now you can see what we have going currently through our community is BA2, and we will get sequencing results from the University Genomics Lab probably on Thursday, and almost certainly we're going to see a lot of BA4 and BA5. So I will be changing this and adding BA4 and BA5, the other sublineages of Omicron. But it's interesting to look at the decay over time of this particular variant as well. It's looking much more like Delta than it looked like BA1, that first sort of skyscraper for Omicron. And we are expecting to see a fair amount of COVID throughout the summer because BA4 and 5 are coming. With regard to hospitalizations and deaths, this is data up through July 3rd, 29 hospital admissions during that week, declining from the previous week of 55, which is good. And of course, those numbers are way below our peak during the Delta wave. If you remember, we had 120, 30, 140 people in the hospital with COVID back during the Delta wave last year. So it's nice to see those numbers are significantly better. But unfortunately, the hospitalization is still, a real challenge. We've had 3 new deaths reported, 10 in the last month, for a total of 574 from COVID. Vaccination rates have continued to climb a little bit. You can see 3 different numbers here on the right. 80.5% of persons in our county with 1 dose. 75% have completed either 1 Johnson & Johnson or 2 messenger RNAs. And nearing half are boosted. So those people who are eligible for a 3rd boost, or some people eligible for a 4th. And of course, there's a fair number of people who are immunocompromised who may be on their 5th dose already because of their immunocompromise. We are on the left-hand side of this graph. You can see we're in the darker blue. So we're doing pretty well on vaccination. We're not where Hood River is. They're the best county if your goal is to be the most vaccinated for COVID, 98.6%. But we're above the 80 percentile. So we're doing pretty well in this county, especially for a fairly large populated county and geographically diverse. Vaccine access, we continue to do a good deal of work in this space. We are not doing those massive weekend mass vaccination clinics we had where we were doing 10, 12, 14,000 doses on a weekend. However, we are doing much more sort of surgical, targeted, select outreach. We also have the Valley River Center Clinic partnering with OHA. It runs Thursday through Sundays, all ages, all vaccines, not just COVID. Will be a really nice addition for the sort of the preschool next month as people are going back to school and they need vaccination to participate in sports or to go to school. We also do a fair amount of this in-home vaccination upon request. We have teams that go out to people who are shut in, stuck in their home. And we're doing a fair amount of that. Last week, we were in Junction City and Cottage Grove for some of that work. Additionally, we have community clinics ongoing in Springfield and Eugene on a regular basis. Testing continues as well, and we have 3 regular community testing events. We have one, see if I can remember this right, the Bethesda Lutheran Church in Eugene. We have one in Springfield at the Bob Kiefer Center, and we also have a 3rd with the ARC of Lane County in West Eugene. Over the course of the pandemic, we've had a large number of tests. We're very high up there on the numbers. You can see Lane County was the highest test counts per capita. So that, of course, started very slowly. You'll all remember early in 2020 where there was a real shortage of testing, and we've really kind of redoubled and rallied and have got a lot of testing opportunities. University continues to test. We're so happy they've entered that space, and they continue to occupy the test, allowing free community testing on their campus. And they will continue to do so for the rest of this year, which is wonderful. I just want to conclude on the COVID side of our update with some horizon gazing. Some of you probably sat in on the FDA Advisory Committee meeting about 10 days ago, looking at what are we going to do in the fall with regard to COVID vaccines? What can we anticipate? And the recommendation from this advisory committee was to begin with a bivalent vaccine. So that vaccine, their recommendation is to have an Omicron variant, so one of the Omicron variants that is causing challenges in the country now, along with the original parental strain. So 2 strains in the vaccine. This is akin to what we've done with influenza for many years. We've had a trivalent and a quadrivalent flu vaccine for a long time. The most common vaccine for flu now has 4 different strains in it, 2 influenza A, 2 influenza B. So this is the recommendation. Of course, the FDA doesn't manufacture these vaccines. They make a recommendation to the manufacturers, and they will try to comply. So we are working closely with our clinical community, including a meeting yesterday. Every Monday at 4 o'clock, we have a meeting with the clinical community. Nova Health and Peace Health and the Oregon Medical Group, et cetera, to talk about response to infectious diseases. And we're working with these entities to try to figure out how we're going to get these boosters available in the fall using their existing footprint, because of course they're doing vaccination every day. Finally, with regard to horizon gazing, I wanted to mention that the university has been newly refunded for their K through 12 saliva COVID work for another year. So through June of 2023, which is very nice for our schools to keep them safe. And this is an opt-in program. I think, as you all well know, parents, guardians can opt in for their kids if they wish and opt out if they wish as well. But it's nice to have that opportunity for our community to have this free K through 12 saliva testing, not involving a swab in your nose, which I don't particularly like, and I think kids like even less. So I will stop there. Happy to open it up for questions on COVID, and we'll do the monkeypox after that.
Thank you, Dr. Lidke. And I'm going to ask maybe Director Gray if the monkeypox presentation can be split from this conversation, and we would have that subsequent to our 10 o'clock time certain. Is that would that work with your team?
Will that work for our presenters?
We can make it work, I think, unless you have patience. Okay, we can make it work.
Yes, we can split.
I appreciate that. Thank you very much. And we have a number of people who are scheduled for the 10 a.m. time certain, and I hate to do that at your expense, but thank you so much for complying, Doctor. So moving right along, discussion questions from the board. Well, that was brief. Commissioner Bozovich.
So not so much a question, but just I finally was unable to continue dodging the bullet for 2.5 years here, and my wife and I both had COVID at the end of June there, both tested negative since. Mine was over more than a week ago. So yeah, did all the isolation stuff. And, but you know, I was happy that both of us were vaxxed and boosted. I had a very mild case, mostly had cold symptoms and a sore throat. My wife, though, that has asthma, and one of the reasons why I was so concerned and trying to prevent transmission, of course, the asthma complicates it, and had many more of the chest symptoms, and in fact, coughed so hard that she pulled a muscle across her back and through her ribs and all that stuff. So she's over COVID, but she still has back issues from coughing so hard. So it's not a fun thing, and we have to continue to be vigilant about this, but you know, I understand some people are you know, getting a little tired of some of the precautions, et cetera. But you know, it was, you know, we had been traveling, and in traveling, it's very difficult to avoid exposures, and apparently maybe Alaska must be a hot spot or something like that, because when I mentioned that I got it, you know, in Alaska, I had about 10 other friends go, "Oh yeah, when we came back from Alaska, we had COVID too." So I don't know, but it's just interesting that you know, the kind of the timing. But it is interesting looking at some of the rates and all that of the spikes and the declines. You know, I kind of wonder somewhat with the first Omicron variant, it spiked so fast and got so far into the population, if that rapid decline was part of a natural immunity, that response where we had so many people that got it that they almost right away weren't going to get reinfected. Is that maybe an explanation of that, you know, the other slower deterioration rates of some of the spikes?
Chair Farr, Commissioner Bosevich. So certainly that is a possibility. And I wish that we could say, you know, unequivocally that we know what happened. We don't fully know what happened. Clearly, a large number of people became infected. A large number of people created antibodies. The question is, how long will those antibodies last? We know now, after just a few months of BA4, BA5, that there is what is called immune escape. So BA4 and BA5 will not have full protection for people who were infected with BA1 in January, February. So there's a little bit of that escape from the prior immunity that people got from infection. So how much? We don't know. And how long will that be? We don't know that either. It's these variants are just too new. So I think your hypothesis is certainly possible. And we had, you know, this huge increase in number of cases. And then so many people got ill so fast that there wasn't a pool of susceptible people, so it dropped very quickly. And we see that with other entities. You know, a classic example would be the church picnic, where there is, you know, potato salad that sat out too long. A bunch of people get sick really fast who are susceptible and actually ate the food. And after that, there's no more susceptible people because the food is gone, so to speak. But we see other outbreaks akin to that.
Thank you, Commissioner. Thank you, Doctor. Further discussion, Commissioner Bernie.
Commissioner Trigger, to you.
I went down the list mentally before
Doctor, I recently had a 5-day visit to one of our local hospitals. And when you talk about lower numbers being hospitalized, one would assume, oh, good, except my understanding is the hospital environment and staffing have changed significantly since March of 2020, with tremendous demands, with inadequate staffing. In some instances, I got lots of stories from the nurses. In many instances, pay in order to attract people and keep people skyrocketing to such levels that there are no dollars actually for hiring enough staff. How has the staff environment changed from your perspective, and to what degree does that suggest, even though there are less people being hospitalized, which is a good thing, the impact it's having in a changed hospital environment?
Sheriff R. Commissioner Birdie, so that is a tough question, and I always am nervous speaking for my hospital colleagues. We speak with them, if not daily, at least several times a week. I am reminded regularly by their chief medical officers that they are not overwhelmed at this time with regard to COVID, which is good. That does not mean they're not stressed. So clearly there are ongoing challenges in the clinical space across the country, not just in our region. They have suffered, as you mentioned your conversation with nursing. There is a shortage of nurses even before the pandemic. We've all struggled trying to hire nurses. And now we have had, as you, I think, alluded to, nurses getting paid a great deal of money to be travelers, to go fill in holes other places. And, you know, good for them. That's capitalism. But there are so many holes to fill. That means a lot of nurses are moving and leaving hospitals and going somewhere else to another hospital. And that makes it tough. One domino hits another, and pretty soon you have a whole bunch of dominoes that have fallen, and you have a lot of hospitals in a bad place. So we're in a challenged place, but we're not in an overwhelmed space in our hospitals. And regularly the hospitals tell us that. That being said, I sure wish that there were fewer hospitalizations from these preventable infections, whether it is COVID or fill in the blank for some other infection. And I think that to those listening today, infection control is important even outside of COVID. So if you can prevent an infection of any kind, you will not only help yourself and your family, but you will also help those who are really on the front lines and challenged at this time.
Thank you, Chair. Thank you, Doctor. Thank you, Chair.
Thank you, Commissioner. Thank you, Doctor. Further questions or discussion? I see none at this point. But I'll mention that a side effect is I understand that wait times for after triage for non-emergency, non-life-threatening emergencies in the emergency room can be 5 or 6 or 7 or 8 hours of wait time in the emergency room, which is an effect of the staffing issues, among other things. Well, thank you. And Dr. Guzman, thank you very much for agreeing to come back to present on monkeypox. We're all anxious to hear your presentation. So at this time, I will recess the joint meeting of the Board of Health and Board of County Commissioners and reconvene as the Board of County Commissioners. And I'll tell you again, which is like a broken record, the clock on the wall in here is about 3 minutes fast. So we're just slightly ahead of our 10 a.m. time certain this smoker IC. So I think we do have time for our consent calendar. Board of Commissioners, we have before us a consent calendar. Do I have a motion?
Chair, I'll move passage of the consent calendar for July 12, 2022.
Second.
Moved by Vice Chair Trigger, seconded by Commissioner Murray. I'll mention that items on the consent calendar, it's a rather lengthy one, can be viewed online at Lane County's website. Click on today's agenda, and each item, you'll see the items that the board has considered when considering this consent calendar. Discussion to the motion. I see none. I'll call for the vote. All those in favor, please say aye.
Aye.
Aye. Passes unanimous. And Mr. Mokrasky, at this point, we are preparing for our 10 o'clock time certain. I will mention that we've been in contact with DA Perlow, who has a presentation on death certificates. And for anybody who's anxiously awaiting that discussion, that will come subsequent to the monkeypox discussion. And I would suspect someplace shortly after 11 o'clock. That's a rough estimate. So, Mr. Mokrasky, please.
Thank you, Chair. Matt McRae is here to do the presentation. I believe we have 4 or 5 individuals virtually that will also be available and presenting pieces. So Matt, I'll turn it over to you.
Great. Thank you so much. Chair Farr, Vice Chair Trieger, Commissioners, thank you for having me here today. Matt McRae, I serve as a long-term recovery manager for Lane County, focused on the Holiday Farm fire. The quarterly wildfire recovery update today will have 2 parts. In the second half, I will provide an update on the metrics you all have been following for some time. But in the first half, we'll have a guest presentation from a team from the Oregon chapter of the American Planning Association. I want to begin by saying thank you to this team of professional planners who have donated hundreds of hours to conduct this study and develop the report attached to this agenda item. This team is comprised of professional planners who all have day jobs in planning. So again, my sincere thank you to this team. The project team consists of Deb Myhoff, who leads the Community Assistance Program for Oregon APA. She's the principal and owner of Communitas, a consulting firm where she collaborates with communities on reinvestment plans, land use and policy strategies, and prosperity initiatives. Erin Riome is a senior associate project manager and planner with CIRA Architects, where she spearheads CIRA's efforts around resiliency and planning and design. Erin is also a volunteer with the Oregon APA and has led the organization's efforts on wildfire since September 2020. Mary Heberling Crichton is the housing planner for the city of Newburgh. She's worked at a number of small to medium-sized cities in Oregon over the last 6 years. Vinitha Murthy is a certified planner with the APA and a certified transportation planner with the Institution of Transportation Engineers, and also an avid equity advocate. Emma Quinn Smith is a community planner with MIG. This is Emma Quinn's second wildfire recovery project with the APA, having recently worked with the Almeda Fire Opportunity Framework for the City of Talent. Again, my huge thanks to this group of professional planners. And lastly, before I turn it over to the project team, I'd like to thank Preeti Shah. She is an important recovery partner who worked with us from FEMA, who connected us with this remarkable team of professionals. So with that, I'm going to turn it over to the project team. I believe I'm going to be controlling the slides, unless you have control obvious to you there. So assuming you don't have control, I'll just forward them as you request.
Great. Thank you so much, Matt. And thank you for that wonderful introduction. And thank you to the commissioners for allowing us to join you today. We're very excited to share a summary of the work and our findings from the Mackenzie River Valley wildfire recovery effort. So next. Before we dive in, I just wanted to give a quick introduction to OAPA and the CAP program. OAPA, for those of you who may not be familiar, is a not-for-profit planning organization that operates across the state. We have a pretty wide and diverse membership and a lot of educational offerings. One of our programs is the Community Assistance Planning Program, or CAP program. And traditionally, this program has provided planning services to smaller and underserved communities who may not have the ability to take on a planning process. But following the 2020 wildfires in Oregon, the CAP program has really worked with a number of different recovery efforts across the state. We've worked with the City of Talent and Santiam Canyon, and now with Lane County. And each of these projects has been different to respond to different conditions and varying needs. Next slide. Matt already gave an amazing introduction to our team. Thank you again for that. And here are the faces behind those names, a number of whom you'll see on the Zoom today. And next, to help set a little bit of context for this effort, we had a number of conversations with Matt and with FEMA early on to determine how OAPA and the CAP program could be of best assistance in some of the holiday farm fire recovery work. Ultimately, we landed on the following, because it became clear that there are survivors who are being left behind during the recovery process. And it also became clear that we would be able to help highlight who those survivors are, how they've been missed, and how to improve planning and recovery efforts in the future to be more inclusive. So to do this, next slide, we first dug into the Vision Link data provided by Oregon Department of Human Services and Oregon Health Authority. And this gave us a snapshot of some of the needs and issues, but even more telling than what was in the data was what was missing. And we'll talk about that in just a minute. To help round out our assessment, we also interviewed a number of caseworkers to get a more qualitative understanding of some of the issues and needs. And from what we found from both of these sources, we compiled a set of key takeaways and recommendations that we are going to share with you all today. So first, on our next slide, and I need to credit Vinitha Murthy on this, who valiantly took on this task of weeks of data cleaning and formatting and organizing all of the information that we received out of the Vision Link data. And ultimately, we want to present this with a lot of caveats because we know that it is highly incomplete. It contains roughly 150 open case entries, and we know that anecdotally, this is just a fraction of the number of survivors who were impacted. Many of the data fields were blank, where information either wasn't captured or wasn't provided. And in order to have an entry in the system, and this is really important, a person needs to have a FEMA ID. And this is problematic, particularly as we're looking at some of the most vulnerable populations and underrepresented groups who may not be eligible to apply with FEMA. They may be distrustful of government assistance, or for a variety of reasons, they may not be capable of submitting the paperwork to be able to apply for a FEMA ID. So we know that the graphs that we're about to show you show a very limited spectrum of the survivors that are in need. But we did want to highlight a few things. So next slide. Of what we did see in the data. So one thing is pretty clear, that there's an overwhelming need for permanent housing relocation, as well as some needs related to employment. And next slide. We also saw with the open cases that were in the Vision Link data, high levels of damage sustained during the fire, with destroyed properties by far in the majority. And next. We also saw that a good percentage of these open cases also showed no insurance coverage to be able to assist in their recovery and rebuilding efforts. So again, that's all we're going to show on the data for now. And we show this with major caveats because we know that this isn't comprehensive, it's not exhaustive, and that there are a number of other needs and other stories that this data just wasn't capturing. So that leads us to the next part of our presentation here. We interviewed a number of stakeholders during the months of March through May, and we very deliberately didn't interview survivors directly. We understood from talking with Matt and from talking with FEMA representatives that that could be re-traumatizing. We didn't want to do that. So ultimately, we spoke with 12 different stakeholders. These ranged from caseworkers to shelter managers to community advocates. And we heard some consistent themes, and that's what we really want to summarize for you today. So with that, I'm going to hand it over to Mary, who's going to talk about key takeaways from those interviews.
Great. Thanks, Erin. So I'll start off with kind of one of our main goals that was for this project was to figure out who was being left behind as part of this recovery process. And so we found 4 kind of categories that sort of encompass those people that survivors that were left behind and currently are being left behind in the recovery process. So lower middle income non-landowners, so renters typically, those that don't have the ability to kind of relocate on property that they already own. They may have been living on properties that they were just renting, and therefore don't have the ability to kind of go back to the places that they were before because they just don't own the land that they were living on. Second would be what we call off-grid individuals. So these are people that were choosing to live in areas very rural, kind of self-sufficient lifestyle that they chose to do because it was beneficial to them, especially for their mental health. A lot of these people deal with post-traumatic stress disorder, and they kind of just they don't want to, live within society to a certain extent and aren't ones that are going to be willing to kind of connect or work with government entities just for a variety of reasons, some being that they don't trust that, some being that they just don't want their information anywhere. And people that just kind of want to stay on their own. They barter with each other. They just have their own sort of lifestyle that they choose to live by. And in their standards were doing quite well before all of this, but without being able to kind of have that trust relationship, it's been hard for them to get the assistance that they need in a way that's going to be beneficial to them, and being able to go back to how it was before the wildfire. Third is seniors. So this is going to be seniors for all variety of incomes, and we'll kind of go into a little bit of reasons why, and then also houseless individuals. Next slide, please. So some of the things that we heard most about related to assistance and help was that the recovery efforts, the help has been sort of slow to materialize for survivors. So there wasn't in place the ability for people to come in right away and provide that assistance that they need. We were heard that people were still just now getting the assistance that they needed, even though this happened in 2020. There also isn't the ability, or there's an assistance and help for those that are within the communities right now to receive long-term assistance on top of all of the other work that they're doing regarding the wildfires. So for example, if they're now having to do all these FEMA reports based on money that they're receiving, there has been extra help to have them kind of still do the regular work that they've been doing as well. So it's kind of asking people in the community to do this extra assistance without, or extra work without having assistance from a variety of entities. And so it's causing a lot of stress and anxiety for people to kind of get this recovery effort done, but it's putting a lot of weight on community members who already had very demanding jobs or lives before all of this as well. And also inadequately trained recovery specialists were initially deployed into the community, which caused a lot of mistrust. It caused a lot of people to not want to get assistance. And so that's why some of it, the assistance has been lacking, is because they just initially didn't have the right person helping them. And so it made it hard for them to come back or want to come back to get assistance later. Next slide, please. All right. And then kind of lack of emergency preparedness was another main takeaway. And with that, it's a lot about insurance guides and plans as well. So many of those in the community were underinsured, so they may have had home insurance, but they had it from back in 1980 maybe. And so they weren't updating their insurance. And so the insurance that they had covered for their home, especially those in manufactured homes, was just not matching the amount of disaster that they received. So insurance wasn't going to be enough to cover any of the costs that they needed to purchase a new home, especially with all of the increased prices of materials over the last 18 months. It just hasn't been enough money for people to kind of recover back to what they had before. And again, this especially hit those that lived in manufactured homes. Case managers also felt that they were unprepared, and there weren't any guides or plans set ahead of time to kind of prepare community organizations to be ready to do it right away. If a disaster comes in, they didn't have any sort of idea of what they needed to do to help the community recover. And so that caused a lot of a slow response and kind of disorganized response at the beginning. And then one big thing we also heard was lack of training in trauma-informed care. So a lot of these community members, survivors, have gone through a trauma and they didn't get the right care that they needed, so that it was going to be helpful for them to get recovery efforts underway, and therefore it caused a lot of untrust or distrust with those case managers, and therefore, again, recovery was going to be slow for them because they lost that trust and were going to come back and get the help that they needed. And then also there wasn't a big community vision in place to prepare the community for speedy community-based rebuilding process. So therefore, the communities didn't have any idea of what they needed to start with when it came to a disaster that happened in their community. So next, thank you. So in terms of people that were trying to navigate the systems to get assistance, it was very hard for them. especially for those who are seniors, as well as those who are middle income residents, because they've never really had to try and access some of these systems. For example, they haven't tried to receive SNAP benefits before. And so going through those processes was a lot to ask of somebody that didn't know what this process was before. Now they're having to do it in a sort of high anxiety, high trauma inducing environment. And therefore it was causing a lot of stress for the people to kind of get the help that they needed when they've never done this before. This is a common issue in general, not just for this particular situation, but obviously survivors that have mental illness or mental disabilities, the deadlines and paperwork that they need to do to get on, say, permanent affordable housing waitlist is going to be very onerous for them. And so that was also an issue that they found as well. And then, as I mentioned before, these off-grid individuals that are wanting to avoid being in the systems for a variety of different reasons, it's hard for them to get the assistance that they need without having to do that. And so there's a lot of that distrust there. And as I said before, a lot of them are dealing with mental health issues, including PTSD, and it makes it hard for them to want to kind of navigate these systems and be a part of it before. Yeah, next slide, please. And obviously all of these issues were exacerbated by COVID. So it was a variety of reasons that made this hard, but COVID made it even harder. So obviously lack of ability for the community to gather and provide support for each other. The transfer of knowledge was a lot harder. So people that, found a way to like, oh, this is how I did it to get the benefits here. And all of this sort of information just couldn't naturally be transferred like maybe it would have if they were able to gather and provide that support to each other within the community. Obviously, costs of goods have increased. Prices of materials and homes have also increased. So it makes it harder for people to reestablish what they had before if things are significantly more expensive than they were 18 months ago. Slide. Also, permitting issues has been a big problem, especially for people that were living in unpermitted housing before the fire. So people that were living maybe on family members' properties, but technically were living in housing that wasn't permitted beforehand. And so therefore they can't get permits again as part of the recovery effort. Again, this is gonna have a lot of issues for people that aren't landowners. And then also the people that are landowners, we've noticed we've had more people selling their lots because of the permitting process and the expense that's been going on with that, and just finding it easier to sell than trying to navigate that permitting process to get things rebuilt for them.
Mary, pardon my interruption. Ms. McRae, keep an eye on the clock. We have 1 hour scheduled for this, and without constraining the amount of time that you have for your presentation, we will need to have time for the board to ask questions and receive responses. So Ms. McRae, please. Mary, thank you.
Understood, thank you. And just as a quick aside, the portion I have for presentation is slightly smaller than typical. So if this first half hour bleeds a little bit into the second half hour, I think that was workable. Thank you, point taken.
Thanks. So I just have, I think, one more slide. Obviously, economic development issues. This has been an issue for a variety of communities across Oregon, especially with COVID, trouble attracting and retaining employees, especially when housing is unaffordable or unattainable for them. And obviously, if you can't rebuild your housing, that causes problems as well. Next slide. And then recommendations. So I'll hand it off to Emma Quinn, who will kind of give the final recommendations that we came out from this project.
Thanks, Mary. So based on our key takeaways from our research and interviews, we have recommendations for next steps in 4 categories: code and land use, housing solutions, community visioning, and disaster preparedness. So in that first category of code and land use recommendations, we would recommend considering updating the Rural Comprehensive Plan and adopting an ordinance that will allow accessory dwelling units, or ADUs, in unincorporated county rural residential zones. And this is in order to provide more housing options and choices for a variety of income levels as part of the recovery process, as many of the deeply affordable housing choices were lost in the fire. We also want to acknowledge that that there are different housing development solutions that will work for different landowners. There's not a one-size-fits-all approach to that housing redevelopment. We also would recommend incentivizing the conversion of existing housing to be ADA accessible and also building and fire code compliant. In our conversations with caseworkers who are working with the houseless population, we learned that those many houseless people struggling with physical disabilities were also struggling to find housing that was physically ADA accessible to them. And this is also an issue that arises with seniors in the community providing accessible housing for them. And as far as the conversion of housing to be more code compliant, this could look like assistance applying for state funds in order to upgrade units, or the county providing financial assistance or another source of financial assistance to residents who qualify. Next slide, please. So for our housing solutions, we recommend identifying the housing needs of those off-grid individuals that Mary mentioned, who lived in areas before the fire, with consideration of a lower scale, lower density options such as tiny home villages or similar housing solutions. We also recommend engaging with local businesses in discussing workforce housing needs and options, and exploring the best practices with workforce housing, and then funding some of those housing and economic development partners. Next slide, please. We also recommend a community visioning process, developing an integrated plan and policies for a comprehensive community recovery process, and also a comprehensive resilience vision for the community, something that would include housing, transportation, community health, social and elderly services, economic development, all of these different categories of needs and issues that have come to the forefront in wildfire, in this fire recovery, will continue, unfortunately, to be an issue in the future. So really coming up with an integrated plan and set of policies to address any future needs, and also plan for a more resilient recovery in the future. Also, we recommend updating the county's land use planning framework to reflect the pre and post-fire needs of the entire community, including those off-grid individuals, seniors, and houseless individuals, so that this rebuilding effort and any future rebuilding efforts may serve all who want to live in the Mackenzie River corridor. Next, please. Our final set of recommendations is for disaster preparedness, and we recommend establishing resilience hubs, which could look like a community center or some other sort of central community gathering place that is designed to offer emergency preparedness and emergency response services. So this could be a facility that's already built, such as a library, where people in the community know that they can go here after a disaster and get anything that they need to kickstart their recovery and survival process there. We also recommend setting up response organizations pre-disaster and include critical qualifications such as trauma-informed care. So this means ensuring that any existing community recovery agencies or social service agencies in the community have some disaster response training, and particularly a trauma-informed care framework for their employees and volunteers. Our next recommendation is to develop and support infrastructure for ongoing preparedness and response efforts, such as working with a community emergency response team, or CERT team, that is specific to the Mackenzie River Valley. There are models for these all over the state of Oregon and across the country that the county could look to establish such an organization. And our final recommendation for disaster preparedness is to establish a trauma-informed training and grief counseling protocol for local disaster responders and anyone in the community who has ongoing contact with survivors. Again, just want to reiterate, like Mary said, in many of our conversations with the caseworkers, that lack of trauma-informed response is what turned people away from initially seeking help. And with that, I thank you for your time and attention, and we'll open it up for discussion and questions.
Thank you, Ms. Quinn Smith and Ms. McRae.
Yeah, so we'll just look to you all to share your questions and thoughts on this presentation. If it works for you, we have, if we take the next 15 minutes for that time, that would leave 20 minutes for my portion, which would be 10 minutes presentation and more Q&A on those slides that I'm presenting, if that works for you.
We'll make that work. Thank you, Ms. McRae. And a host of very superb recommendations, many of which kind of mesh with recommendations we've already had prior to this discussion. So I'll open it up currently right now for questions from the Board of County Commissioners. Questions or comments? Commissioner Buck, followed by Commissioner Bozovich.
I really appreciate all that the group has put together here. There's a lot of information here that folks in staff and volunteers and people on the ground and myself have been trying to work through for a very long time. And this is a great way to kind of document it and know that even though we've done a lot of important things in recovery, there's still quite a lot left that the community needs in order to fully recover. And we've talked about some of the specifics, as the chair has mentioned in here, such as, let's say, ADUs that's come before the board already. And we know that we're moving forward on that as soon as planning comes back to us. And some of these subjects are covered through our Oregon Solutions process that is currently underway. In that process, we, just for education for the rest of the board members, was initially a 1-year project. And we knew that this is a multiple year recovery effort, and we are now underway in extending that to a 2nd year and trying to continue to work at some issues that are identified here, and other issues like case managers came from other agencies that we as the county didn't have any control over and needed their assistance and didn't have the staffing for at the time. But it's clear through the identification that really popped out at me is the trauma-informed care piece. It was clear at the time, initially, people were overwhelmed, including the case managers, some of which were from fire-affected communities themselves, and were going through issues of their own and also trying to provide this care to the community. And that is like a double whammy of trauma issues going on. And they're absolutely right. There was no game plan for this when it happened, when we had fires raging all over the West Coast and up and down Oregon in the same year. This was new, like a disaster we've never prepared for to this size before. And without a game plan, you know, you're working while you're building the plane while it's flying in the air, basically. So there are clearly issues we know we would do differently next time. And it's important to document it in places like this and through our emergency preparedness department here locally at the county. And this is in coordination with, you know, other fire affected communities up and down the state that we talk about this, because we aren't the only ones that have been experiencing things that they've discussed here today. There are lots of other fire affected communities that are going through the issues that have been presented and still working it out. And I think it's important that we continue to collaborate with those communities. It's also really important that we stick together as you know, communities and counties up and down Oregon in order to tell our legislature that we still need assistance. We're still not sure whether the Oregon House is going to continue to have their wildfire committee, and we need their assistance to move changes that are beyond the jurisdiction of the county that have been identified, especially when it comes to land use and building codes in order to build a variety of different housing styles that currently don't exist because they're not allowed. So it's important for us to continue in maybe the legislative committee to talk about what we can do to work together with other commissioners across the state in order to make sure that the House knows how important that wildfire committee truly is to the recovery of all fire affected communities in Oregon, including McKenzie. Thank you, Chair.
Thank you, Commissioner. And Commissioner Bozich, I think I mistakenly identified you as the next speaker, so to the board. Then I see no one else in queue to ask questions or make suggestions, but I believe that Commissioner Buck covered a lot of the things that we would all talk about, including innovations that we're already looking at in terms of housing types, in terms of ADUs and land use, that not only would affect inside of the Holiday Farm area, but really can make a significant impact beyond it. The Holiday Farm gives us an opportunity to really raise things to the top level of our attention as we address some of the other important issues. And as we look at some of the other recommendations from the committee, and by the way, anybody who's watching online, all of the slides that were just presented are contained in the agenda item today. But regarding innovative responses such as establishing trained trauma respondents. Recently at the Mental Health Summit, for instance, we had a presentation on it's called the Trauma Intervention Project, which is a relatively low cost, high impact project that we could take a good, strong look at as a part of the recommendation that we're receiving today from your staff or from your colleagues, Mr. McRae. So anything further from the Board of Commissioners? Then let's move directly to your presentation, Mr. McRae.
Great,
and,
thanks.
Thanks again to I'll say Emma and Mary for their presentations.
Yep, and Aaron and Deb, the whole team, thank you so much. Agreed. And the one, I guess, final point I would put on these recommendations is that there's a lot of opportunity for us to put the ball in motion so the next community in Lane County that has a disaster is better positioned to deal with and recover from whatever that next disaster is. This certainly isn't the end of large scale natural disasters. Again, thank you, team, for your efforts. They'll be presenting at the Oregon Solutions meeting on Thursday, so many of our community members will have a chance to listen to this presentation at that time. All right, so I'm going to move on to the standard Holiday Farm Fire Recovery Update. Again, this is a little bit shorter. I just have about 6 slides here. You've seen most of these before. I've just added the next extension. So we currently have, as of yesterday, 65 Holiday Farm Fire survivors who are in state-supported shelter in Lane County. So this is state-funded hotel rooms that folks are living in. And that's 65 individuals. The number is thankfully steadily going down. I will also note that we have at last report 10 of the FEMA trailers occupied upriver in Rainbow. That's of course not sheltering, it's full service housing, but it is temporary in nature and important to note, as Commissioner Buck has been involved in the conversation, that direct housing mission that FEMA is hosting is scheduled to end in September. The state has requested FEMA to extend that direct housing mission to March of 2023, but there's currently not an answer from FEMA on that. We are convening a team this week to talk about housing opportunities and options for those 10 families that are residing in those trailers. The point, I guess, here is that there's a lot of transition going on. There's a fair amount of federal support that is stepping back. So, for example, FEMA individual assistance, which is all the resources that are provided to individual survivors, that terminated in March of this year. So folks can no longer apply for those types of services. We're just running into some of the end of the standard kind of support for survivors. And as Commissioner Buck noted, we are not done with recovery yet. And then just quick permits stats here. As reported last time, our official damage report notes 574 dwellings lost. I just want to note that there were some questions about the accuracy of some of those records in that damage report, in that damage assessment. And so that damage assessment is under review, but for the time being, that's the best assessment we have working, and I'll let you know as soon as that's been revised. Dwelling permits submitted, 215, which is 37% of that total 574 reported as lost. There's another 141 currently being issued and 13 in review, and 61 dwellings now complete, which is up from 45 last time I reported to you in April. And so this is kind of the trend line, right? That top blue line showing the total number of homes lost at 574, building permits submitted up to 215. In October of last year, it was 166. And then home completions in October of 2021, we had 12 completed, and we're up again to 61 as of yesterday, or July 7th, rather. Just to get a scale of the number of properties that have been sold, again, 600 properties affected by the Holiday Farm fire, and 107 of those have transferred ownership since the fire. Slight increase in the number of free emergency RV permits that have been issued. And the total value of permit fees waived is just over $1 million. It hasn't gone up much since I reported this number to you last in December. And I attribute that to the majority of those being retroactive. And so the actual number of increase on a monthly basis isn't very significant. That's all I have by way of an update for you. Happy to take questions.
Thank you, Ms. McRae, for a very concise but really full of information and presentation. I'll look at the board for comments, questions, beginning with Commissioner Bozovich, followed by Vice Chair Trieger.
Matt, could you back up to the slide that had the permits submitted and permits issued?
Yes.
Because that one. So permits submitted are 215, but then there's the 141 issued and 13 in review.
Right. And then
so they don't add up to 215. So I'm kind of
right. And then adding the 61 that are complete. So that's total since,
so,
yeah.
Okay. That's where I was missing.
Yeah.
The slide jumped before I was able to see that. Okay. 61 complete, 13, 141 is 215. Great. All right. Thank you.
Sure. I will try and write that in a way that is more intuitive for others who are reading this as well. Thanks for the question.
Simple math is if you keep the column in order, it's easier to add. But that's
well, it's the notes behind it shove that tab over. But yeah,
precisely.
Well, the numbers do add up. Thank you, Ms. McRae and Bozovich, Vice Chair Trieger, followed by Commissioner Burney.
Thank you, Chair. Thank you for the presentation and to the team that went before. Really appreciate it. One is maybe a little rhetorical. I'm not understanding as well how the FEMA support works, but you said the timeline is sort of running out and people aren't even eligible to. Is FEMA, I assume, establishes their time frame for when people are eligible, and it is independent of context on the ground. Is that right? Is there just that's just the way they operate? And
yeah. Yes, that's correct. It is a standard 18-month period for individual assistance, and COVID has dramatically shifted the context here, I think is your point. I have asked my colleagues at the state if that is something that we want to collectively ask FEMA to reconsider, because just the time frame for everything has been so difficult under COVID. It does seem like 18 months is incredibly short, and if it's not flexible, it's a problem. So if you have thoughts about that, I'm certainly.
I guess I'm just curious if there's been conversation with other colleagues across the state, let alone even the country, that FEMA put rules in place that didn't account for a global pandemic, as none of us did until it was upon us, and whether there's just a movement that we can be part of instead of sort of being a small lone voice in the FEMA wilderness on that.
Right. Yeah. I have reached out to state officials to ask that question. My experience in working with FEMA generally is that issues like this that aren't typically amended are extremely hard to get adjusted. But I think it's worth asking. That's my view. I'm certainly putting that forward to my colleagues, and I'll let you know how that goes.
Thank you. My other question, really simply, if you know, we've been hearing a lot about folks off grid. Do you have a sense of the number of people that is? How many humans we're talking about?
Yeah, we do have a sense. So my colleague Dana Davison, who works in public works and tech services, she's a data analyst who's been working on data crunching for a housing plan that we are working on, has highlighted that it's a pretty significant number. I would guess it to be somewhere on the order of 100 households who were living in situations, perhaps more than that, who were living in situations that we don't consider housing, right? Long-term living in an RV, for example. So it's a significant component, especially when we consider like the number of dwellings lost to be 574 if we add another 100 or so of households that were displaced. That official number will be reported in the housing plan and the data analysis that Dana is currently finalizing.
Thank you.
Thank you, Vice Chair. Commissioner Burney.
Thank you, Chair. I don't see how you do that without looking. You got good peripheral vision. Number one, my recollection is FEMA originally declined a housing mission here.
Initially, correct.
Yes. Ask them, demand it, organize whatever is necessary. My opinion, speaking only for myself. Number two, recovery is not going to end by March of 2023.
That's correct.
So I don't know where these timeframes come from, how they're defined or delineated, but obviously they have nothing to do with reality. And I don't know what we can do as it relates to that. Excuse me. I would predict that the longer that we also have heard from a number of sources that support is starting to be cut back. Emergency, money's expended. Emergency's not over. Oh, well, good luck. I would predict that a number of what we consider to be illegal units are better than no units. And just because the state or the county hasn't sanctioned them, don't anticipate they won't be built or developed, and that's not necessarily a bad thing, my opinion. And then I have a question and a comment. My question is, Chair, do we know when? I know this body is very supportive of ADUs in rural areas of the county. Do we know when that's going to be brought back for action to this body?
That's not on the imminent horizon. I'll make a note, Commissioner Burney, and hopefully before the end of this meeting, I'll give you a response to that.
Thank you, sir. And my last comment, I don't know if this body remembers, but when we were at Ms. Gray, I know I owe you some links. I apologize. But when we were presented recently with a joint presentation from Emergency Services and Public Health and talking about the intersection of those, back then we were just a week or two ago, we were discussing something that this study is calling resilience hubs. But we were discussing community-based, we were community-based pre-existing structures, be they school cafeterias, church basements, Grange halls, UFW posts, whatever they happen to be, that there's a process that makes sense where communities or entities designate those spaces to be literally resilience hubs, to be retrofit so that whether in a heat event or a smoke event or a cold event or a natural disaster, people weren't traveling 15 minutes away if the roads were good to get to a center, but it was in their community and they knew. Now we have another term for that and another proposal suggesting that. And this term now is called resilience hubs. I call them net zero plus retrofitted buildings because that was my experience. And now we're also looking at them being, during disasters, groups organized to provide one-stop social services at those resilience hubs. I understand from my discussion with Ms. Gray, who's been very generous with her time with me. I appreciate that. that sometimes we need to get in front of federal money, and yet, you know, by the definition of government stretched resources, we tend not to do things until we can find dollars for them. And we, I believe, are in a unique position to negotiate pilot programs that can provide for community-based resilience hubs as per the recommendation, that provide one-stop social services as per the recommendations. And I would just encourage us to be as entrepreneurial as possible, to find resources, to demonstrate what could be, because I think this is part of the answer for all communities. Chair, thank you for allowing me to continue on.
Thank you, Commissioner Burney. Further discussion?
If I may just make a couple of comments there. Your comment about the FEMA direct housing mission, you are correct that it was not initially authorized by FEMA. It was only because this body pushed to make sure that that happened. I also want to acknowledge that there are direct housing missions in other parts of the state that were affected by the fires at the same time. And so it's not just Lane County that will be affected if they decide to end those in September. We are all very hopeful that they will extend them. I also want to note that, to your point, 6-month extensions do not add stability or consistency and make it difficult for us to do planning when we're a couple months away from that deadline and still uncertain as to whether the extension will occur. So those timeframes are not very helpful. In terms of resilience hubs, I'd like to acknowledge the community in the Mackenzie River Valley who understands this, I think, better than anybody. And many of their community centers that did survive the fire did serve that purpose. The Upper Mackenzie Community Center has been retrofitted with heating and air conditioning and other services to enable it to continue to support the community that way. And many of those buildings that are expected to be rebuilt are adding that kind of those kinds of features so that those buildings can serve that purpose in the future. My major concern actually is not as much with Mackenzie because they are leaning in, they do see the need. It's the rest of Lane County where we have those community centers and those buildings and those opportunities, but those retrofits haven't been done and aren't funded. That's all of my comments. Thank you.
Can I please? Thank you very much, Mr. McCray. I would encourage wherever to, in addition to the retrofits you mentioned, to have battery storage, to be able to power, and also to have food lockers, and to be able to power the continual freezing of food, the running of bathrooms and toilets, and the running of kitchen appliances for at least 60 days. And that's entirely feasible. But thank you very much. And thank you, Chair, for allowing that.
Thank you, Chair. Thank you, Commissioner.
Thank you, Mr. McCray. Then moving along, I will mention to anyone watching that the presentation is the Mackenzie River Valley Wildlife Recovery Assistance Background Finding and Opportunities is incomplete in our board packet for today. And it's a planning research project provided by the Oregon chapter of the American Planning Association. And thank you for bringing us that. I'm going to say one thing really quickly about planning for the future and really retooling the way we think about facilities, including housing. There's one statement that was made that is that Commissioner Burney, a quote from you: illegal units are better than no units. I'm in full agreement. The people who are suffering from being exposed to the elements, being exposed to lack of sanitation, illegal units are better than no units. Not that I would prescribe illegal, I'd prescribe more ways to make units legal. And the county could consider updating the Rural Comprehensive Plan and adopting an ordinance that will allow accessory dwelling units in unincorporated Lane County rural residential areas. Let's turn up the heat on that. This has given us an opportunity to look at it with more clarity than we would have otherwise. But let's turn up the heat on that because, as you said, Mr. McCray, it's not just the Mackenzie Valley, it's the areas beyond. And when we look at resiliency hubs, as Commissioner Burney has so eloquently described, resiliency hubs, for instance, provide fresh drinking water. And we do have school districts who are already beginning in that direction. South Lane, for instance, during the recent smoke event, we're prepared to turn buildings into clean breathing areas. The school districts are prepared to do that. Bethel School District is doing it already. So one thing that we do have in common in all of our communities throughout Lane County, all the way from Oak Ridge and beyond, all the way to Florence, is we do have school buildings. It's a natural area to look. And when I first came to the United States, every place I turned, there were 3 triangles pointing down to the ground, which were fallout shelters. They were scattered throughout, and the fallout shelters did provide emergency food. They provided emergency water. I hate the concept, but that's the type of resiliency hub that really we should be prepared to have for people not just who are affected by the events, the recent events, but really anything that could happen. It gives us an opportunity to look with more clarity once again on the things that we need to do countywide, not just in the Mackenzie Valley. With that, anything further on this discussion? Commissioner Bozovich.
Thank you. I meant to say this earlier, but I'll state it now. I just want to state my support for Commissioner Buck's call for pressing the legislature to continue the wildfire committee, and also just in general for us to push the legislature around resiliency and emergency preparedness. Cascadia is still looming, and when we talk about having a community plan to recover, that's, this was wildfires that affected, 7 or 8 counties in Oregon, not Cascadia, which is going to impact the entire state, basically, either being involved in recovery and evacuation or having been impacted. So our ability to try and get people to understand the need for these regional resiliency hubs and community hubs is really important, because there will be a certain number of people that get stranded in an event like that, away from home, and there'll be plenty of people that will have lost their homes. So everything we can do to set up seismically sound, well-prepared, multi-purpose resiliency centers, I think is good. It used to be in rural areas your Grange Hall, or the local church, or the Odd Fellows, or whatever. There was always, and I can't tell you how many of those buildings in my district are standing empty and deteriorating, that used to be the community center. So that needs to change. We need to work, but our resource constrained county can't solve that by ourselves, and it's got to become a much larger effort. So I really appreciate the focus on trying to make sure this happens statewide. At the same time, that's also if we can get all of our partners across the state that experienced, the wildfires, to push FEMA about deadlines and COVID exceptions, and possibly get our entire state congressional delegation to start talking to FEMA about that, because that's where the pressure really can come from, is from Washington, D.C. to FEMA. So we just need to keep all working together. So I appreciate Commissioner Buck's call to do that.
And thank you, Commissioners. Thank you, Ms. McRae, for an excellent presentation. We have a full document in our position right now regarding the recommendations. And once again, thank you. We'll move along in our agenda. In a moment, I'm going to recess the Board of County Commissioners and reconvene as the Board of Health, Board of County Commissioners. And I'll ask Director Gray and Dr. Ludke, Dr. Guzman to step forward. And Mr. Kincaid, you can probably inform the DA that we're moving a little bit closer to the death certificate presentation. Then at this point, I will recess the Board of County Commissioners, reconvene as joint meeting of the Board of Health and the Board of County Commissioners. And we'll move forward, Director Gray, with your team and Dr. Guzman, and a presentation on monkeypox. Thank you.
Yes, thank you.
Good morning, Chair Farr, Commissioners, thank you. I'm going to start with a brief reminder of 2003. Monkeypox has been here before. Some of you may remember when monkeypox came to America in 2003. I was working at a state health department, a different state epidemiologist at the time, and was involved in part of the response. And what happened was there was a shipment of about 800 animals from Western Africa came into our country to be sent out to pet stores. And a few of those animals had monkeypox, and they were placed in other pet facilities next to prairie dogs. For whatever reason, I've never had a prairie dog as a pet. Perhaps some of you have. Apparently, they're nice pets. And there's a fair number of them that are adopted in the upper Midwest of our country. I don't know why, but I guess they're good pets. Turns out that prairie dogs can get monkeypox. They've never been exposed to it because they're North American prairie dogs and monkeypox is in Africa. But those animals imported from West Africa were put in cages next to some of these prairie dogs. The prairie dogs got monkeypox. They were adopted and became a pet. And then some people in the upper Midwest got monkeypox. So that's the first time that monkeypox ever left Africa to our knowledge. It's, again, not our first rodeo with monkeypox. And I think it's reasonable to bring up that past experience, partly because it did not become endemic in North America. There was a massive public health and public safety response, and those pets and the supply chain was altered. And we did not have monkeypox in the animal kingdom for the last 19 years, which is a good thing. Let's hope our response to these human monkeypox cases mirrors that, and eventually it burns out and we don't have endemic monkeypox every year for the rest of our life. But I think it's worth noting that we can do this effectively and prevent some diseases from becoming endemic, meaning always present. So these are typical lesions of monkeypox. I'm sorry for the graphic nature of them, but it is a pox, and this is what pox looks like. Smallpox, monkeypox, cowpox, they have these large fluid-filled blisters, usually very, very taut, filled with fluid. Initially a clear fluid, kind of like a blister you get from trauma, and then later it becomes pus-filled. And these are not the classic lesions. These are the classic lesions. They're not what we're seeing now in many cases. So we'll talk briefly about that because the virus seems to have changed a little bit. Our situation update, as of July 8th, there's over 6,000 confirmed cases in 58 countries. Those countries include various continents: North America, South America, Europe, Australia, Africa, the Middle East. Most of the cases are occurring in gay and bisexual men, but not all, by far not all. In the USA, as of July 8th, we had approximately 600 cases in 36 states. The early cases that we saw, basically the first part of May and a little bit of June, they all had travel history. They all went to other states or countries that had outbreaks. Now we're seeing cases without a travel history, which of course means it's spreading locally, it's spreading regionally, it's spreading within the boundaries of North America. Oregon, when I put these slides together, had 3 cases. Dr. Guzman is our point person for this, and she'll give us an update on the number of cases in Oregon and Lane County when we get to her slide. But suffice it to say, we have a few cases here in Oregon. Monkeypox basics, early on, like the first slide I showed you of that, really kind of gross slide, early on, people had a viral-like syndrome, kind of like the flu. They had muscle aches and body aches. They had a fever. They did have some lymph swelling, which you typically don't get with the flu. So lymphadenopathy, swollen lymph nodes. And then you get the rash after that. Seems as though the virus has perhaps changed a little bit because now we're seeing people with rashes without that flu-like syndrome before. So that's a symptom we're sharing with our clinical community so they're aware that not all these people have the flu before they get a rash. Patients are infectious once any of the symptoms begin. So they're either infectious when they get the rash, they can spread it to somebody else, or if they get that prodromal kind of flu-like syndrome, they can also spread it. So this is our conversation with the broader lay community as well as the clinical community about when infection transmission can occur. This is a virus. Many viruses, the incubation period is quite long. Can be as long as 21 days. So somebody could get exposed today and, we're not going to see their symptoms possibly until early August. But most people, it's within a week, maybe 2 weeks, they'll start to get symptoms, but it can be pretty long. We have a fair amount of history with monkeypox. I mentioned what happened in 2003. Even during the pandemic, the last couple of years, we've had a few monkeypox cases imported into the United States. So we still have some history with those cases imported. It's important to know that we have ongoing systems for monkeypox that have been responding over time, even though they're very small numbers of these imported cases over the last couple of years. There is some good news. Those prior imported cases that I mentioned, there was no spread on airplanes. There was no spread in other areas where people were in casual contact with others. This is a virus that, although it can spread through respiratory transmission, it's typically very close personal contact, either touching skin or the soiled linens from those ruptured blisters people can get it from handling the soiled linens. Another part of good news is we already have 2 vaccines that are FDA approved. So certainly wish we would have had vaccines when COVID hit a couple years ago, but we didn't, of course. We have 2 FDA approved vaccines, and we also have several antiviral medications already approved, already in use. Which is very good. So we're in a different place with monkeypox. This is not going to be the sky is falling kind of outbreak. We're probably going to continue to have cases because there is some ongoing spread, as I said, locally. So we're going to have a few more cases, handfuls of cases, not thousands of cases. So I'm going to shift to Dr. Guzman. As I said, she's been our point person on this, leading the monkeypox response and doing a very good job. Dr. Guzman, take us forward.
All right. Good morning, commissioners and Commissioner Chair Farr. So I want to explain something before I give you the right numbers. This has changed a little. The test that the Oregon State Public Health Lab and now LabCorp locally uses is a PCR-based orthopox virus DNA test. Pretty much this is a qualitative test that will either detect it or not detect the presence of an orthopox virus. And this is a family. What we don't know is what type of pox this is, what type of orthopox this is. Under the orthopox family, or the orthopox family, we see that there's monkeypox or MPX, there's cowpox, there's gerbilpox, there's a bunch of other poxes. And what we want to determine is which kind of pox it is. So our labs here, both LabCorp and the Oregon State Lab, is able to tell us if we have orthopox in that sample. Once that's determined, then the patient becomes a presumptive case. That sample is sent to the CDC, and the CDC will determine what type of orthopox this is. And that's when they will be able to confirm that this is indeed an MPX or monkeypox case. So in Oregon, we have 6 presumptive cases, 1 confirmed already by the CDC. Out of these 6 presumptive cases, 3 of them are from Lane County. So Lane County has 3 of the 6 presumptives, and it also has 3 suspect cases, which we will know between today and tomorrow if these are positive for orthopox virus. When we first identified our first case, we immediately called Oregon Health Authority, and they've been working with us daily, and they've been very supportive all along. So we are very appreciative of that. They immediately released treatment and vaccines, the Jynneos vaccine, from the Strategic National Stockpile. And they overnighted it to us, and we had been able to use it. They gave us 10 vaccines, two of which we have used. And we will be receiving 30 more vaccines in preparation for the World Athletic Games that are coming and the different activities that we're going to have in the next month or so. So we're getting prepared for that. They've also provided us with TPOXX, which is a treatment for MPX. And we have been able to use administer 3 out of 10 of those treatments. Now, it's important to note that the cases here in Lane County have not had any international travel either. They have not had, possibly one had some state-to-state travel, but the majority have not, which from a public health perspective, this speaks to local community transmission. And so we expect to see more cases, and it is highly likely that there are undiagnosed cases in our community that we are not aware of. The good news is that thanks to COVID and the lessons that we learned through that process, we have the infrastructure in place to be able to respond efficiently and effectively to MPX. We communicated to the media within hours of knowing that we had a presumptive case. And we also sent out a Health Alert Network. It's an email to all providers in Lane County, letting them know that MPX is in our community and how to diagnose it, how to test for it, and all the logistics needed in order to be able to proceed with testing and diagnosing. This helps prepare us and bolsters up our response. We also have excellent community partnerships. We value that very much. We have a strong partnership, for example, with the HIV Alliance. And thanks to that, we have a robust targeted messaging capability, and our contact tracing has also been on point. Additionally, equity is extremely important to us as well. It is a primary consideration for us. And so our focus has been two-pronged in that we have done targeted outreach to the MSM community, which is the men who have sex with men, while publicly acknowledging that this is not an MSM-only infection. This is not an STI-only infection, but the whole community in general needs to be vigilant, needs to pay attention to the risk factors, to the signs and symptoms, because we are or could be at risk and just due to the mode of transmission of MPX. So that concludes my part.
Okay, so we will turn it over to you for questions or comments. Thank you, Dr. Guzman.
Thank you, and I'll call on the board for questions and comments, and just a reflection on something you said, Dr. Litke. I believe you said looking at cases in the handfuls, not hundreds and thousands. Is that about what you said?
That's correct, Commissioner.
Which is a cause for somewhat calm, but nonetheless, looking at the pictures and looking at the transmission potential, of course, vigilance is critical. Commissioner Buck.
He does have good peripheral vision there.
Yeah. Playing soccer.
I really appreciate the info. Speaking of poxes, I'm familiar with chicken pox. Still got a scar on my eye for that, which was really common back, when I was little. So I'm very curious, what is the recovery process for somebody who gets it? And I'm guessing then you give them a vaccine, or how do they recover and how quickly can they recover?
So the recovery period could be about 4 weeks. You just have to give time for the pox to go through its stages. They can get treatment, which is the TPOXX antiviral, within the first 4 days of starting symptoms. That's the best time to be able to take that medication, and it shortens the sickness period, the infectious period. But it's about 2 to 4 weeks, and it's a self-limiting infection, and but the antivirals do help. And the mortality rate of this strain, there's 2 strains. The strain that we have is a type 2, it's a mild one. So the mortality rate has been 1% as it's known in endemic areas. So not so much, we haven't seen mortality in the United States, maybe 1 case on a person who had a decreased immune system, an immune compromised person. But other than that, no.
You just have to go through the process of it going out of your body over time.
Yeah, the risk, there's certain risk with the infection of super infections, bacterial infections, and that, we all know that those can spread through the body and whatnot, but that's most of the extent of it.
Thank you, Commissioner. Thank you, Doctor. Vice Chair Trigger.
Thank you, Chair. Thank you for the presentation. Really appreciate it. I've been following this. One of the things I understand that's of concern is the transmissibility that the virus lives on surfaces. It doesn't need a human host for a good amount of time. And any thoughts about that or clarification or words of caution to the community that you want to share about that?
I'm happy to start. So when we look at transmission of any agent, a parasite, a fungus, a bacteria, virus, you both need the ability of it to transmit, and you also need an infectious dose. So for example, with COVID, we don't exactly know the infectious dose, but it's probably around 1,000 virus particles. There are some bacteria like Salmonella. If you eat an infected potato salad, you need to eat several 100,000 Salmonella to get sick. There are other things like norovirus, the cruise ship virus. You only need 10 to get sick. Mm-hmm. So we're most concerned with regard to monkeypox, with exposure to a fair amount of the pus or the soiled linens and towels and bed sheets. We don't know exactly. Is it the size of a dime? Is it, the size of a dollar bill with, soiling on there? We don't know exactly that amount. Dr. Guzman might have more to add, but there's an infectious dose and it's not just a very slight touch, which is why you don't see transmission of this with casual contact. It's close personal contact for an extended period of time.
Yeah, I don't know what that number is either. But when we do have a case, we recommend them to do their own laundry, do their own chores, because touching their bedding or towels that may have some of the secretions, it can be transmitted that way as well.
I'll add one more thing. It's easy to kill. So, standard laundry temperatures, in fact, one dryer on high heat will kill it. Washing at 140 degrees, your water temperature will kill it. So it's easy to kill. It's just the knowledge of knowing that it's there before you actually go for the kill step, so to speak.
Yeah, I guess that was my question is, do we know how long the virus remains active on a inanimate surface?
I don't think we know. I do not know. We can get that information for you if it's known.
Thank you. And I also just, in closing, just want to appreciate you talking about how nationally, globally, there's a higher instance among men who have sex with men, not because it's specific to that population as anything inherent by virtue of being a member of that group of folks, but it's because of the nature of the interactions and the number of partners and so on. And so it's really important that we don't we don't perpetuate stigma. And I know some people say, well, you shouldn't call that out because that stigmatizes that group. And it's like, no, that's actually a textbook case of stigmatization when you don't call it out because we're putting everybody else's comfort over a marginalized group's safety. And so I appreciate you bringing that into the presentation. Thank you.
Thank you, Vice Chair. Douglas, I see no further discussion. Oh, I'm sorry. You're obscure.
What happened to that peripheral vision? We were so admiring.
Commissioner Burney.
Thank you, Chair. Doctors, from a public health perspective, whether we're talking monkeypox or COVID or something I don't know about, with the World Games here and with people, athletes and fans, from my understanding, is about 200 nations competing. Has that modified the public health sort of presence at all, or no?
So I'm happy to start on this as well. There is a medical director for the World Championships, Dr. Hans Notenboom. Perhaps he's spoken to this group before, I don't know. We work with him regularly. I've been speaking with him recently. I think Dr. Guzman has too. A couple times a week, we work together collectively on how it is we can maintain, infection control and safety at that event. And when monkeypox popped up, so to speak, in early May, we began talking about what the risk is and what could be done. And really the biggest issue here, because this is not easily spread, and you've already seen the numbers internationally, we don't have millions of cases. We have, 6,000 cases on the entire planet so far. Probably some are undiagnosed, so maybe we have 20,000 cases, but we don't have millions or billions. It is not easily spread. Dr. Newman and I talked about a harm reduction sort of look. If anyone has a lesion that they don't expect, they should, number one, cover it up, because you can't spread it if you cover it up, and then go seek attention. And that's a good harm reduction strategy. We are hoping that messaging, and we helped write some messaging for Dr. Notenboom and his group. We're hoping that messaging gets out. People do not have the ability to get a monkeypox test today and a result, in an hour. That's just not the process. So the harm reduction method is really going to be helpful. And I think the overall risk is really very, very low.
Well, Doctor, that's why I also mentioned COVID. I was reflecting on Commissioner Bozovich's personal comments and travel. And I just, so I included that maybe inappropriately so in my question.
Commissioner, I don't think it was inappropriate. I think we're all concerned. You have 200 countries showing up. What might they bring? In addition to world-class athletes, world-class athletes, they might bring something else. So again, we've been working very closely with the team. And I think that with regard to monkeypox, we can certainly have safe world championships because of the really low transmissibility and the fact that even sitting next to somebody at an event, that is not close, intimate contact. It may be some contact, but it's not close, intimate contact. So I think the risk is very low for this particular virus.
And I think to speak to the broader question, there is a partnership with the Oregon Health Authority doing surveillance for looking for diseases within our sewer system, alerting us ahead of time if we think that we're beginning to see something out of the ordinary. So we will certainly keep the board and the public up to speed as we learn more about any of that surveillance and if there are concerning results.
Thank you both, and thank you, Chair.
Thank you. Commissioner Bozovich, followed by Vice Chair Trieger.
Thank you. Two quick questions, one directly related to the monkeypox, which is what are our efforts we're using to keep this out of the unhoused population? I have great concern that, how that might impact that population if it gets into it, particularly seeing some of that population is trafficked. Are we making an effort there?
Well, we did send the HAN, which is the Health Alert Network that reaches out to all providers in Lane County, alerting them of the situation and the logistics on how to determine and how to test. And I myself have had a handful of conversations with different community providers, that one of which is an organization that serves this specific community on patients that they have right there, and they have a question on could this be and what do I need to do next. So we've had both try to reach out to all the providers in Lane County and on a one-to-one basis.
And I would also just add, as you mentioned, Dr. Guzman, that we have really great contact tracing capabilities now, and that is absolutely critical in slowing or stopping the transmission of the virus. So public health is working diligently on that as well, led by Dr. Guzman.
And Dr. Ledke has his 4 o'clock Monday provider calls, where it all started with COVID, just only COVID, and now is transferring to other conditions in the community, one of which we've talked about is monkeypox or MPX.
So I would highlight, Commissioner Bosovich, for your benefit, those 4 o'clock calls, darned if the people don't keep calling in. It's just amazing. It's been 2+ years, and we get dozens of represented groups ranging from our hospitals, our CCOs, our long-term care facilities, a number of CBOs, And it is as Dr. Guzman said, it's a collective that began mostly with COVID response, but now we include all sorts of other conditions of public health import, including monkeypox. So a fair number of these community-based organizations have outreach efforts to persons at risk, persons who are intermittently homeless, houseless, and we're helping in that space as well. So it's never perfect, but we're doing quite a bit, actually.
Thank you. So while I've got you, and somewhat unrelated, but related to the worlds in some ways, there's been recent photographic evidence of a blue-green algae outbreak on Fern Ridge Reservoir, but it's not listed as being warned against in the state database. And I was wondering if you guys know anything about the ability to test for that, particularly knowing that that's one of the largest bodies of water closest to Eugene during high tourism, where they might not be aware of blue-green algae risk, knowing it does permanent liver damage and other issues. I'm really concerned about that. So I don't know if there's any, I was hoping Dr. Warren be here so I could ask that question about, can we get it tested? Can we look into that? I have a real concern that I'm getting multiple social media posts with photographic evidence of potential blue-green algae on Fern Ridge Reservoir. And with the worlds coming to town, I think we need to step up maybe some of that, testing and surveillance work that goes with trying to detect and warn people, because folks coming from all over the world may not.
On the MPX makes me wonder, has there been any explicit communication with hospitality industry, specifically hotel and motel workers, and then folks who may have Airbnbs, if we're hearing about sheets and towels, whether we're just encouraging or making folks know the importance? I mean, here we have a workforce, a low wage, largely underinsured, predominantly women of color workforce that is potentially, by virtue of their profession, coming in contact with the virus. So I'm just wondering if there has been, or if you would consider some really targeted outreach to that workforce.
For sure. I know that we've had some discussions about this topic with the Oregon Health Authority because of our need to use some of their resources. So definitely those are ongoing discussions, and I will try to push that forward as well.
Great, thank you. Just because with all the visitors coming to our community, staying in hotels and motels, it's the folks who keep them clean who will be here left behind. Thank you, literally and figuratively, oftentimes.
Doctors, thank you very much for being here. Director Gray, I have a long list of questions I'd love to ask doctors right now, but I will delay those questions. At this point, we'll move back into our regular agenda. At the sound of the gavel, I'll be adjourning the joint meeting, the Board of Health, Board of County Commissioners, reconvening the Board of County Commissioners. Then we are reconvened as the Board of County Commissioners. And Ms. Mokrajewski will move back to item 6A on our agenda, which is Order 22-07-12-11 in the matter of delegating signature authority to the County Administrator for the District Attorney's Office Death Investigation Division contract with the SLAC 5 LTD for transport services. And we'll welcome District Attorney Patty Perlow. DA Patty Perlow is elected county-wide, and welcome to the Board of County Commissioners, Attorney Perlow, District Attorney Perlow, and Ms. Mokrajewski. I see you're moving slowly, so we'll continue with DA Perlow.
Thank you, Chair Farr, Vice Chair Trieger, and Commissioners. I really appreciate this opportunity to give you a little information about this consent calendar item about the contract with SLAC 5. Serenity Lane has an award called the Unsung Hero, and to me, Todd and Joy Slack, who created SLAC 5 for this community, deserve an Unsung Hero award. I don't want to take your time to talk about the economics of the funeral industry and how that caused our transport company for moving deceased persons to the morgue to go under financially. And the panic that ensued for me and for my death investigations team that we weren't going to have that service available to move people who have passed, whether in their home here in Eugene or out in the woods, up on a mountain, over at the coast, to the morgue for the state medical examiner to be able to perform an examination. And so when that company went under, the county Board of Commissioners and the county administrator stepped in to say, okay, well, we will fund that function and put out an RFP. And the SLACs created SLAC 5, and that was the only response to that request. And so at a time when we were about to come into a public health crisis without the ability to move deceased persons, Joy and Todd stepped up. And then the pandemic came along. Deaths have been on a dramatic increase. We're on record pace this year. We've been on record pace the last few years for deaths in our county. And SLAC 5 sent notice that they were going to have to terminate the contract to move the deceased persons because they couldn't staff. They just didn't have people to respond. And so panic ensued again. And it was with the support of Steve Mokrahysky and Steve Dingle, I can't thank enough for stepping in and helping come up with a solution that was workable for Joy and Todd SLAC to be able to keep staff available to perform this vital function to our community and to bring to you a new contract that adequately provides for a difference between transporting from 5 blocks away in Eugene to having to move somebody out of the mountains or out of the woods or over at the coast, and recognizes the amount of time that that takes, the increase in fuel costs, that it takes more than one person to be able to transport people, particularly there are circumstances that, well, let's just say there aren't a lot of people who would be willing to step up and do this work. And so I just want to let you know how appreciative I am that we have been able to come up with this contract to ensure that that work continues on and that the SLACs receive the recognition that they so deserve for being willing to do this work and work with us. Thank you.
Well, thank you for highlighting that, DA Pearl. That's something we don't think about on a regular basis. The 375,000 people in Lane County, how dependent we are upon that service, and we don't even know it most of the time. And you pointed out the partnership with Mr. Mokrahysky and our Steves, Mr. Mokrahysky and Mr. Dingle, and we certainly appreciate that. You know, Commissioner Bozovich is the only person among us who was here when we had a panic in the death investigation community regarding cutting the budget for the death investigators back in 2011 or 2012, I think it was.
2012.
But it only comes to our attention when emergencies begin to exist. So thank you, DA Perlow. Any questions or comments for the DA? Then thank you very much for your patience in joining us late.
Thank you. And
oh, we do have an order before us. And you can wait for this if you'd like. We have before us then Board Order 2207-12-11 in the matter of delegating signature authority to the county administrator for the district attorney's office, Death Investigation Division with contract with SLAC 5 Limit Ltd for transport services of deceased persons. So, Vice Chair Trieger.
Chair, I'll move passage of Order 22-07-12-111 as described.
Can you say the order again?
I can.
But please, because I messed it up. So moved by Vice Chair Trieger and seconded by Commissioner Bozovich, Order 2207-12-11. Discussion to the motion. I see none. Then I'll call for the vote. All those in favor, please say aye.
Aye.
Aye. Passes unanimously. DA Perlow, thank you so much.
And all I can say is, phew. I'm not going out there.
Thank you.
Chair, I'm going to apologize.
Very good. Then, Mr. Mokrahysky, with your indulgence, we will take about a 5-minute recess of the board before we move along with the what is going to be item 7 via discussion on Measure 109 implementation. So we are in recess for 5 minutes. We'll reconvene, not by that clock on the wall, but at 11:33. item 7B, a discussion on Measure 109 implementation and local government role. Measure 109 is the upcoming the legislation on psilocybin. And Mr. McCreasky, I'll turn it over to you to introduce the staff.
Thank you, Chair. I think I'm going to turn it over to Mr. Kyler, who's with us virtually, to walk through the presentation. There is a you don't have a recommendation in your packet. You do have options to consider. I will just share that one of the reasons we did not make a recommendation for you today is one, this is the first time we've had this discussion with the board, so we have not received any feedback previously from you. Two, this is a time-sensitive matter, and as it relates to the potential referral to voters locally here in Lane County, and we're up against a pretty tight time frame. So we wanted to leave it open to the board with options for you to consider. So I just wanted to share that, and I think Mr. Kyler will be able to walk through the details of this discussion with you now.
Thank you. Thank you, Administrator McCreasky. It's Alex Kyler. I hope you can hear me okay.
Affirmative.
Yes, thank you. Chair, I'm going to be a little challenged because I'm unable to be in the room today. I believe that Eve Gray may still be in the room with us, and I do have online here Rachel Surslev, who is a planner with Land Management Division. So I think if the board does have questions on either land use issues or the health-related issues, you may need to help me in terms of better identifying if particularly Eve Gray is looking like she may have an answer, because I just can't see her from where I'm sitting. At any rate,
Mr. Kyler, we have you in trinocular vision, and I'll give you an alert if Director Gray has a comment.
Thank you. So you have a packet in front of you, and I was really delighted to hear the the plethora of public comment this morning. I think it gives you a sense of what Measure 9 is all about and what it envisioned. It did pass in 2020 at the general election. It passed in Lane County with about 60% of the voters affirming it. Not all precincts voted in favor of the measure, but a majority did. And there's provision in Measure 109 that a local government can opt out of the program, essentially. And what I want to be clear about is how local government is defined in terms of the opt-out. So individual cities may adopt an ordinance and present it to the voters of their city. A county may also do the same thing, except present it to the voters of the unincorporated region of the county only. So you'll recall this is somewhat like marijuana in that respect. When we referred, for example, a tax measure to the voters of unincorporated Lane County. So I just want to be very clear that what the presentation today and the board packet entails is really the question of whether the board wants to move forward or not on this question of opt-out, knowing that it only would affect the unincorporated regions of the county. So I think I hope the packet has done a good job of describing what the measure does. Obviously, I put the measure into the packet as well. It was codified as written, as adopted by the voters. The legislature never did touch it in 2021 nor 2022. There's uncertainty in my mind about whether the legislature will or will not do anything in 2023, particularly after the conversations that, in fact, are happening all over the state. And right about now, as a matter of fact, because we've got a number of local governments that are contemplating these questions, just as you are right now. Administrator Mokrohysky and I were on a meeting of county administrators last week, And this was a very big topic. There was a lot of information sharing about who was or who was not bringing items to their Board of Commissioners. So we don't know a whole lot about what the actual outcome of all these conversations will be. I did put into the packet what we do know thus far. Lynn County, for example, has referred something to their voters to opt out. We do know that Washington County is taking up the issue. I don't know if they will, don't know how they're going to vote. In Lane County, we know that the cities of Coburg, Cottage Grove, Dune City, and Lowell have forwarded something to the county clerk to ask her to put the ordinance onto the ballot for their cities. I am informed that the City Council of Eugene will be taking this up as an informational item, but it's unlikely to refer it to the voters. Apparently, within the City of Eugene, every single precinct, voter precinct in the city voted in favor of the act. So I think they're, at least the staff told me he would be surprised if the City Council did anything with this. So I think there's a couple of sections of the measure that I probably ought to just highlight for you. This is just in kind of in order of the issues. In section 26, for example, on page, which is on page 24 of the packet that I provided, there is definitely some uncertainty about how that language will work. This is not uncommon when a citizen initiative is drafted. Sometimes they look a lot different than how legislative council might draft a bill. And section 26 provides, I think the intent, we understand the intent was to say that a service center, this is what a service center is, where the psilocybin drug would be administered to a patient. The service center can't exist in a residentially zoned area of a city. That's what it's trying to say. There are other people who read it that say a service center could not be located in a city and only in a county. And so there's sort of a difference of opinion there. I think definitely the intent was to say that it can't be located in a residential zone inside of a city. It's silent with respect to residential zoning in a county. So there's still that issue there. Section 81, which is on page 46 of the packet, speaks to the ability of a local government to adopt time, place, manner standards, much like with marijuana. Section 83 of the Act on page 47 allows that a local government could repeal an ordinance at any point in time. Section 128 on page 68 does outline the authority of local government to prohibit or allow through an ordinance and the referral process that is at the heart of today's discussion. And then finally, section 91, page 49 to 50, has some language about allowing a service center in conjunction with the crop. So this gets to a little bit to the issue of some of the issues we've struggled with over the years about uses on farmlands. So for example, we've had a lot of conversations at the board about like farm to table restaurant kind of operations in the county. And so this is another sort of piece of this act that raises, at least raised my attention, because of it would allow a service center to be operated in conjunction with a growing operation which can occur on farmland. So there's that kind of question. There's rulemaking that the state has undertaken. There's 2 phases of rulemaking. They've completed one. That rulemaking had really addressed mostly about how these service centers, the staffing will occur, what sort of training the staff should have, who trains the staff. The next set of rules that will need to get done before January 1st will actually address more of the facility types and may get into some of the land use, but we haven't seen those rules yet. But we do know that OHA needs to get those rules done by January 2nd, because that's when they are under this act supposed to begin licensing these kinds of facilities. So we've got a fairly good chunk of rulemaking that hasn't occurred yet, and we really don't know the outcome of yet. And that particular issue was raised in the conversation that Administrator Mokryski and I had with the other county administrators about the unknowns of what that rulemaking is actually going to look like. So I think I'm going to stop here. And again, probably the best thing is to have a bit of a robust discussion with the board. And again, we've got resources here from both the healthcare side and the land use side. Mr. Chair.
Thank you, Mr. Kyler. And looking at section G of the board packet, you've given us a series of options for the board to consider. So that is in today's board packet, and direct staff to schedule work on time, place, and manner, do nothing, or direct staff to begin work on an opt-out process. So with that, Mr. Kyler, I'll turn it over to the board for questions. And we'll begin with Vice Chair Trieger.
Thank you, Chair. Thank you for the presentation. There may be more, but I just want to start with a clarifying question. It's my understanding that if we do nothing, we are automatically opted in, but subject to whatever this rulemaking that we're not clear what it will look like yet yields at the state level. However, I see in your summary, it says governing bodies of a city or county may adopt ordinances to be referred to the electors to allow or prohibit the establishment. So if I'm understanding, we could refer something to voters that would prohibit and only in unincorporated, or allow it with our own rules, or do nothing, and we are then in effect allowing it and with the state's rules. Do I have that right?
Mr. Chair, Commissioner Trieger, yeah, I think there's actually another option that you could also consider, which is that you could wait 2 years and refer at the next general election as well. There's nothing, as far as I can tell, that is sacrosanct about this coming general election. You could do it again in a coming general election. I think the issue there is that you may have a situation where the landscape or the industry may get populated a bit, and then the county could be in an awkward situation of sort of having some businesses grandfathered in and some not grandfathered in. But yeah, there is, I think you've described it accurately with, as I said, the one indication that you could probably take up the action again in several years if you so desire.
Right. So if we do nothing, we're opted in, and then if the industry doesn't move in any part of incorporated Lane County, we're in the same situation we're in right now in advance of the next general election. But
correct, and you can see it. As Mr. Chair indicated in section G of my memo, this is part of our problem, is that the timeline is working against you here in terms of a whole lot of time to give you the flexibility because of the timelines of particularly of getting an item onto the ballot for the general election.
So,
follow-up, Commissioner Trieger.
No, thank you, Chair. So my one follow-up then would be, and forgive me if I'm not retaining this. I understand the ballot measure was written to say at the next general election, but does that tie us into general elections moving forward, or is it simply the first opportunity is the next general election after passage of the or implementation of the measure? In other words, if we didn't do it this general election, could we in an off-cycle year moving forward?
That was my point, Commissioner Trieger, is that I believe that you could do that. You could say, well, let's just let it ride right now, and then in 2 years we could take another look at this. Again, I think the dynamic that you might experience at that point in time is you'd have some businesses that could be established in the county, and the question would be what would happen to those businesses if you were to do something to, for example, prohibit.
Yeah, no, I understand that. My question was, are we locked into only being able to take action in a general election cycle?
The general, yes, the measure does say the general election. That's the most specificity it has. It does not say the general election of 2022, for example.
Thank you, Mr. Kyler. No, it's really not any clearer to me yet. So let's continue with the discussion. Commissioner Bozievich.
Thank you. So I'll first make note that this did pass with 20% margin in Lane County, and in my district in the unincorporated precincts, it passed in 5 out of the 8, and overall passed by a small margin, even in rural West Lane County. So I'm loath to overturn voters' decision. So I'm leaning towards the do nothing side. In addition, this isn't quite like marijuana where there's the odor and traffic issues that we were seeing with grows, where there is a definitive neighbor impact. I'm not familiar with the neighbor impact in this industry at this time. So I also think coming up with local time, place, manner is probably knowing our staff resources right now and running another election to do so. I'm leaning towards the option of do nothing.
Hey, Commissioner.
Mr. Chair. Sorry. Mr. Chair, Commissioner Bozievich, I want to be clear. It's my understanding the time, place, manner would not have to be referred to the voters. The only thing that needs to be referred to the voters is the question of the opt-out. The authority to provide time, place, and manner in Section 81 is not dependent on a vote of the people.
Thank you, Ms. Carroll. Let me rephrase that, see if I understand it. That do nothing means simply do nothing at this time regarding opting out. We could still prescribe to staff the time, place, and manner of both production, distribution, et cetera.
Correct.
Thank you. Commissioner Buck, then Commissioner Burney. Well, don't move your hand as if you're gonna.
I'm just right here.
Commissioner Burney.
Thank you. I agree that it's far from us to overturn the will of the people we supposedly represent. Number one. I also believe we don't have to refer anything to voters. If I'm not correct, you said we have to. I don't think we have to do anything. In addition, I was really persuaded by the testimony this morning during public comment. And I was persuaded by the notion of compassionate use, the notion of therapeutic, this is medicine, it's therapy, and a regulatory framework ought to be developed. And if we do nothing, it will be developed, it is being developed. So I am completely side on doing nothing and allowing this to move forward as the voters of Lane County have requested.
Thank you, Commissioner. Then I'm going to work on more clarification in my mind, and hopefully it helps other people. So if we do nothing, Mr. Kyler, once again, we can opt to subsequently direct staff to develop guidelines and or even ordinances regarding production, distribution, et cetera, outside of city limits.
That is correct, Mr. Chair.
And in the meantime, the request by the cities, the smaller cities that you've suggested that have gone to the recorder, they can opt out as a city. Is that my understanding? That's clear. So that would be immaterial to the decisions we make today. They can continue with their desire and their request. Okay, very good. It seems fairly clear to me. Further discussion. I'm not seeing any further discussion, so let me see if I can give you some instructions and see if I get head nods from the board. Do nothing. Is that so? Really, what we're looking at, that was a bit glib. If we elect to do, if we decide to do nothing at this point, it means ORS Chapter 475A and the OHA rulemaking will become the operative framework at such time as that does move into place. That correct? And then if we were to change our minds, or a subsequent board were to change their minds in 2 years of the next general election, we could opt out, but we would run the risk of having businesses already grandfathered in performing business at whatever level they may happen to be performing business. Does that seem realistic? Then it seems to me that the instructions you're receiving is to do nothing in terms of preparing an ordinance for opt-out, monitor the situation as OHA and the rulemaking process moves forward, and perhaps give us a report, as reports may be due, regarding what is happening with the rulemaking. In the meantime, we will stand by the will of the people, which just about every single precinct in Lane County, with the exception of 20% of the precincts, perhaps in West Lane County, that we're aware of. Not sure of the others. We're really following the will of the people in saying, let's not move forward with an ordinance at this point in time. Keep an eye on the rulemaking process. And as far as Commissioner Bozovich, you mentioned the smell of a manufacturing process. I grew up in dairy country, and that's where these things grow, is right out of those frisbees that lay on the dairy, on the pastures. But I don't think that has anything to do with the production of facilities. So
medical quality.
Medical quality is a little bit different. So to the board, Vice Chair Trieger has a comment. Please go ahead.
Thank you, Chair. I would also just request, as just to be clear, because if we were opting out, we are only opting out the unincorporated portions of Lane County. And you have mentioned in the memo the cities that you understand are planning to opt out, and the likelihood of the largest city, Springfield, or excuse me, Eugene, not taking the issue up, so default opting in. Anything else you hear from any of the other cities, particularly the second largest, Springfield, just be curious to be updated not only on the rulemaking, but anything you hear from other municipalities and actions they might take would be appreciated.
So without further urging from the board, just let us know what transpires as we move forward in other cities. And at this point, Ms. Mokrasky, no need to prepare a first reading for July 19th because we don't need one. And Mr. Kyler, keep us apprised as to what happens downstream from here. Anything else on this particular item?
Mr. Chair, the only item I guess I don't profess to be an expert in LMD's business. The time, place, manner work. I think they do. Typically, LMD does have a way to queue up work. I don't know enough about this to know if time, place, manner work would be something that we would want to undertake as a county. I just raise it to, maybe Rachel could weigh in just to see if that's a conversation that they do need board direction to begin that kind of work or not. I'm not particularly clear enough, I guess, on their operational procedures.
And Mr. Crowley, I'm trying to envision the complaints that may come forward that would prompt us to more hastily move forward with a land use decision. So, Ms. Sarslev, anything you'd like to add at this point?
I have assessed a little bit what this would look like under our current code, and I think there are some paths for establishing these types of licenses within unincorporated Lane County. So I think there are some things that could happen under our current code, but the board might wish to further regulate how these operations exist with the time, place, manner regulations. And so I think we would be looking for some direction from the board to initiate a code amendment of some type if time, place, manner regulations were wanted.
Excellent. Thank you, Ms. Sarslev. Commissioner Buck.
I thought I'd just suggest maybe they could report back to us after they've had a chance to review it a little bit further when it comes to their side of implementation.
So, Ms. Mokrasky, I would concur with that, what Commissioner Buck has suggested is, along with monitoring the rulemaking, report back from LMD as to what recommendations they make after they've more thoroughly assessed the situation. Anything else as far as instructions for Mr. Kyler, Mr. Mokrasky, and Ms. Sarslev? Alex, do you have everything you need? Mr. Kyler, you have everything you need at this point? Mr. Mokrasky, do you have everything you need at this point?
Yes, thank you.
Then I think we are concluded with that particular item. And once again, thank you to the people who testified this morning. The clarity of discussion this morning was remarkable, quite frankly. And we'll move along to, Mr. Kyler, thank you. Move along to item 7C, which is order 2207-12-12 in the matter of designating voting delegates for Lane County for the purpose of voting at the 2022 National Association of Counties Annual Business Meeting, which is in Denver, I believe, the end of July. Is that correct? I do not believe any commissioners are planning to attend that meeting. Mr. Mokrański.
Next week, actually. And I wanted to say, I'm the masking here where there's confusion, of course, because it's like some people wear masks, some people, I just want to share, I'm making the choice to, when I'm in close proximity to other people indoors, to put a mask on. So if there's just sharing that. The National Association of Counties annual conference is next week in Denver. I will be attending Wednesday through Friday. I'm facilitating a session, a pre-conference session on diversity, equity, and inclusion for county commissioners and county administrators and equity staff on Wednesday. And then we have our National Association of County Administrators meetings Thursday and Friday. Judy Williams will also be in attendance, and Jenna Cusimano will be in attendance as well. Both Judy and Jenna have been working to support my work and our work with the National Association of County Administrators. So they're going to be there for that. And I believe that Judy is planning to speak on an FQHC resolution there. So I just wanted to share that. Mr. Kincaid will walk through the discussion about delegation of voting, but you do have 3 individuals that would not elected staff that will be there representing Lane County. So we certainly could take on any delegation of voting that you may wish to provide.
And just for clarity, do we have 6 votes? Is that right? Is that what we're allocating?
Yes, we do, Chair Farr. So good afternoon, Chair Farr, Commissioners. This item is being brought forward to allow the board to designate voting delegates for the 2022 NACO annual business meeting. Voting delegates decide all the business actions and election of officers during the meeting. And the number of votes we have is determined by the amount of dues that we pay. This is actually still based on the 2010 census. The NACO board is going to take up whether they're going to make any changes to dues later this year, but it's still based off of the 2010 census. So we do have 6 votes. NACO encourages member counties to authorize just one person. That's for ease on their part, but they also have no rules. We have great discretion in how we allocate the votes. For example, last year we allocated 5 votes to Commissioner Buck and 1 vote to Commissioner Bozovich, and that's totally within your authority to do so. It could be any number of elected officials, appointed officials, or staff. Historically, I think we've kept at the commissioner level, but there's nothing that stops you from delegating any number of the staff that Mr. Mokrański mentioned. The only requirements for delegates are they have to be registered for the annual conference. The county has to pay their 2022 dues, which we've already done. And then they have to be designated by 5 p.m. Saturday, July 23rd. The voting takes place on Sunday, July 24th. There's a 9:30 to 11:45 slot. I did not write the time zone. I think it's Mountain MDT, yeah, is what the time is. But it's in the morning, the last day of the conference. I've included a board order with blanks, very similar to what the alternate order was last year, where all I need from the board after your discussion is the names or name and how many votes you'd like to delegate. I can fill that out and then work with Ms. Jones to have the final order cleaned up and not blank and after your approval. So with that, Mr. Chair, I will pass it back to you for questions, discussion, and potential action.
And I will ask a clarifying question before calling on Commissioner Buck. Under the therefores, we have 5 lines, and it seems to me that line 1 needs to be filled out, line 2 needs to be filled out, and 1 or more of 3, 4, and 5 need to be filled out.
Chair Farr, yes. Whatever names that you give me will fill one or more names will fill 1 and 2, and then I just added 3 lines, but I could put up to 6. We could designate 1 vote to 6 people, but it fits nicely on 1 page, and it gives you that flexibility.
So then 1 name is all you need. Potentially 1 name is all you need with the option of more than 1 name. Commissioner Buck.
Thank you, Chair. When I was talking with the Transportation Committee there at NACO, the question came up, you know, last year we were able to do this because I was there in person, some not. It was challenging because it was a mixed hybrid meeting. It's my understanding that this meeting is not hybrid. So you have to be present in order to vote, and none of us are going. So I'm not sure if this item is actually moved.
Chair Farr, Commissioner Buck, that's one thing that's not entirely clear. So they're using an online voting platform. It won't be hybrid this year, but they're using an online voting platform. So whoever we designate as our voting delegates, they're going to receive, I believe it's text messages and emails, and then vote that way. So while I think that they saw I'm guessing they saw the benefit of having that kind of online platform and how it was kind of complicated to do the hybrid, but everyone's going to be doing it online. I think the best experience and the best way to do it would probably be to have someone in attendance, but it would seem that the way they have it set up, because you're doing an online platform, you would still be able to vote. That being said, I haven't been to one of these annual business meetings, so I don't know exactly what the operations are within. So you might just kind of be blind and receiving text messages and not as much information.
The challenge is you aren't in the seminar.
Yes.
You don't have the information on what you're going to vote for unless they provide that in advance to people who aren't attending.
Which I haven't seen yet, so.
Thank you, Commissioner. Then before I call in Commissioner Bozovich, we could, for instance, insert Mr. Mokrahysky as the name, as the voting delegate. Does not have to be a county commissioner, correct?
Chair Farr, that's correct. Any staff or otherwise that you'd like to appoint.
Okay. Commissioner Bozovich, and then Commissioner Bernie.
It just has to be somebody that's expected to register and attend and pay the registration fee. Voting Sunday, and I heard you say you were Wednesday through Friday or something. Or is any of the rest of the staff going to be there on Sunday?
I believe Judy is there through Sunday. Do you know, Jeff?
I don't know off the top of my head.
We can check to see if Judy, she did send me, hang on one second.
The question I think staff would be, how do you want us to vote?
Yeah, that'd be the secondary thing. I guess we should provide some direct.
But I'm not sure.
But just whether we even going to have somebody there to physically cast the votes.
Just vote the way we would, okay?
And
yeah, I like those directions.
Yeah.
Which is Chair Farr, which is something that Judy and I talked about before this meeting. Is, you know, in the past, I think we've kind of assumed that there were 5 votes. Before the last couple of years, I couldn't find any actual delegates. So I think that there was an assumption that there were 5 votes. We have 5 commissioners. They each have 1. But over the past couple of years, we have designated, but we've left some discretion up to that the commissioner that you designated. There hasn't been, you know, specific instructions included with it outside of, I believe, if I'm remembering the discussion correctly, last year, Commissioner Buck did mention that, you know, she was going to try to carry forward the, you know, the intent of the board when she was voting.
Then, Commissioner Bernie.
Thank you, Chair. I don't mean to take your spot, Commissioner Bozovich, but your answer is not going to. Actually, I was going to mention the same thing. But now for background, if I may, 6 votes out of how many votes total?
Chair Farr, Commissioner Bernie, I don't know the exact number.
The impact 6 votes are going to have.
There are counties with hundreds of votes. It's based off of population. So the size of our county versus, you know, all the counties in the country is.
So 6 votes is not going to make or break an initiative.
I would say that every vote matters, and but in the grand scheme of things, 6 is not a significant number of votes.
Okay. And just, if I should know this, I apologize. What is our annual fees for NACO?
Chair Farr, Commissioner Bernie, $7,034 for the last couple of years. That's been the amount.
Gotcha. Thank you. As soon as we find out if there's anyone there to vote for us.
Thank you. Vice Chair Trigger.
Thank you, Chair. Just practically speaking, for the purposes of this order, do we need to determine which, if any, staff member, or can we say one of the staff members registered to be determined, like just for the sake of moving our business along today. I see everybody frantically trying to text with Judy and find everybody's itineraries, and can we move this order along if it is the will of the board to have a staff member proxy vote on our behalf? Do we actually need to specify that person by name in order to move this piece of business?
So Chair Farr, Vice Chair Trieger, I think I was thinking through my head at the same time you were talking about probably the cleanest way to do it would be to designate Mr. Mokrajewski, and then he can delegate that further. And then it wouldn't take an action of the board. He could delegate as long as you're comfortable with Mr. Mokrajewski doing that and knowing that his intent would be to be one of those few staff we know will be there.
Yeah, I think that's a great approach. And the other thing that we can do, and if you want to specify in a motion, is we will cast a vote on issues that are consistent with the board's already approved priorities and policies documents, so that we're not going to cast a vote on something you either haven't taken a position on or something that is contrary to something to a position that you've already taken.
Right on. Then not too long ago, Mr. Mokrajewski, we entrusted you with about $1 billion worth of public money. I think we trust you. Any further discussion? Commissioner Bozovic.
So I guess I'll just say that would preclude voting on second vice president with these 6 votes, because we haven't discussed candidates or who to vote for. But yeah, a lot of the other votes are, you could look at our legislative priorities document and fit them into that. And I think we can trust Mr. Mokrajewski or Judy to carry out the board's previously set priorities.
With the exception of the elected officers of NACO. Okay. Very good. Then I think we're ready for a motion. If somebody has one ready to give me.
Mr. Chair, I'll move approval of Order 22-07-12-12 in the matter of designating voting delegate for Lane County for the purpose of voting at the 2022 National Association of Counties Annual Business Meeting, and that we insert the name of our county administrator as our designated vote caster, and give him the ability to delegate that responsibility to another staff member present at the conference.
Moved by Vice Chair Trieger and seconded by Commissioner Buck. Any discussion to the motion? And Ms. Mokrajewski, that is clear to you, direct from the board. I see no discussion. I'll call for the vote. All those in favor, please say aye. Aye. Passes unanimously. Thank you. We'll move along then, Mr. Mokrajewski, appropriately so, to announcements from county administration.
Thank you, Chair. I have 4 items that I wanted to cover with the board. The first, and Director Gray is here along with Jason Davis from Health and Human Services. The first was a request, I think, from Vice Chair Trieger regarding an update on hospital capacity and impacts on the World Games Oregon 22 in just a little over a week here. The second item is an update on access to MLK Boulevard, which is also related to the World Games event. The third is an update on the pension bond that the board previously discussed and provided some direction at the end of May. And the fourth is an update regarding sheltering of a number of individuals that were previously sheltered with FEMA funds. So if that's okay with you, so a few media items to take on. I know we're past the noon hour here. But I think I'd invite Director Gray and or Jason up here to talk a little bit about hospital capacity that remains a concern. Of course, we're in trauma season. If you saw me hobbling around, that was a result of summer activities that a lot of people go out and do and have minor injuries. And of course, what we want to do is make sure that our hospital capacity is available for individuals that really need access. And so both with the surge of COVID trauma through these summer months, and then an influx of population in the next few weeks as we welcome the world to Lane County, we want to be sure to share sort of what our messaging is around preserving hospital capacity. So I think I want to turn it over, Eve, to you and to Jason just to walk through some messages for the board and the public as we move forward here through the summer.
Sure, I can start and then you can catch up. So what I will say is that having worked in a hospital for 8 years, we know that that not everyone visits the hospital for a reason that a hospital would be needed in order to serve that individual's need. So right now, in terms of preserving hospital capacity, we're focused on partnering with our local hospitals in a communication and education campaign to our community regarding where they should go for different types of concerns and complaints so that we can feel confident that our emergency departments are open and able to respond to those truly emergent situations. So I'll go ahead and turn it over to Jason, who can talk more about the specific campaign and where folks can find more information about that.
Sure. Thank you, Director Gray, and good afternoon, Commissioners, Chair Farr. We have partnered, as Director Gray mentioned, with Mackenzie Willamette and Peace Health to establish a home-based website. It's lanecounty.org/where-to-find-care. And that's something that each of the organizations, Lane County Public Health, or Lane County in general, as well as Mackenzie Willamette and Peace Health, will all be hosting on their sites. And then we will go out in a joint media effort and social media effort to try to spread that word, educate our public about where to appropriately use medical care, whether that be an urgent care, primary care, or a emergency room, and just help people understand, because it can be complex, and you know, kind of segmenting those out in your individual needs can take some consideration. So we want to provide materials for the public to be able to make those informed choices ahead of time, and then also working within the practice groups themselves, like OMG, Best Medicine, Nova, et cetera, to have some signage around this as well. And while it's a small effort, and there are many inputs into what can cause hospital capacity issues, this is something that we can have some efficacy over. We can establish and reinvigorate those partnerships that we trusted and relied upon during COVID, and then really get this message out. And I think it's going to be something that we continue on beyond Worlds, because certainly Worlds does provide that immediate need, but knowing that we have all kinds of things happening this summer and into fall, where our hospitals will be that community asset we need to lean on, we will continue this educational process.
So we just want to provide that update. Happy to answer any questions if you have them.
Questions from the board? Okay. Good update. You know, time will tell. You know, the need for hospitals, but we understand the lack of staffing. And we talked earlier about regular emergency visits. If it's triaged into being not life-threatening, it can take 4 or 5 or 6 hours to see an actual physician or move into service in an emergency room. So thank you for the update. Ms. Montgomery. Thank you, Director.
Okay, 1 down, 3 to go. MLK Boulevard, we had a discussion with the board previously. We were able to, thank you, to be in large part because of the discussion with the board, the concerns that the board expressed in that meeting several weeks ago. We were successful in being able to work with Oregon 22 to make some adjustments to mitigate impacts to our operations on MLK Boulevard as a result of the World Game events. MLK Boulevard is now closed for main thoroughfare access until July 28th at 5 p.m. So a little over 2 weeks from now, July 28th at 5 p.m., MLK Boulevard is closed again for main thoroughfare. Through access eastbound to Springfield or westbound to Eugene will be detoured via Leo Harris Parkway. Local access to Lane County facilities at the MLK campus will remain open via the west from Scout Access Road and or the east, which are the Serbu entrances. Both entrances will remain open except during the marathon and race walk event times. There are 5 event days, 3 of which fall on business days. Those business days are Friday, July 15th from 9 a.m. to 7 p.m. where access only via the east entrance for race walk events. The other business day is Monday, July 18th, midnight to noon. with access only via the West Scout Access Road for the marathon events, and then Friday, July 22nd from 9 a.m. to noon, access only via the East, the Surbu entrance for race walk events. The other 2 dates are Sundays, Sunday, July 17th and Sunday, July 24th, where there will be some limited access. During events where participants are in or near the roadway, local traffic will be limited to emergency vehicles and escorted access only. So there still will be access for people that absolutely need to get in and out. It's just going to be more restricted. Traffic flow will return to normal July 28th at 5 p.m. As I mentioned, access limitations to the MLK campus have been communicated with Lane County staff, patients, and public safety officials. Any questions on that? So there was, as we know, with the World Game, you welcome the world. We're welcoming the world to our community. There are going to be some impacts and some things that we'll have to deal with. And I think we've done the best that we can to mitigate those.
So, Ms. Margarisi, staff who are scheduled to work will have access to their offices and their desks at all times.
Correct. Yes.
And the youth campus will have access at all times.
Correct.
Very good.
Yes. We are working with staff and patients, you know, to reschedule appointments or to make sure that during those days where there's more limited access, that we try to relieve that burden both from staff and from patients there, as well as provide opportunities for shuttling and other things for folks. But there will be access. Okay, 2 down, 2 to go. The pension bond. So at the end of May, the board approved board order 2205-2413. So May 24th approved for staff to move forward with pursuing a pension bond with a rate up to 4.5. We subsequently signed an initial agreement with a lender on May 31st. The actual financing that we locked in was 4.43%. The financing amount was, I'll just say, approximately $286 million. We locked the rate on May 31st. When we locked it on the 31st, had we not secured a bank placement at 4.43%, it's estimated that our market rate in that bid environment would have resulted in a higher rate of 4.92%. Of course, today the rate would have been much higher. So we secured about half a percentage point lower than what we would have had we have gone to the market. But because we did this, what's called a direct placement, in this case with Capital One public funds, we were able to do a direct placement. We closed on Thursday, June 28th. And we received that lower rate, about 0.5% lower than we would have if we would have gone to a public placement. I want to share with the board that Capital One specifically commented that they appreciated the board's ability to approve the board order in a timely manner while the rates were lower, which enabled the purchase to occur. You gave staff flexibility. You sort of, you boxed us in to say, we don't want it to go over a certain rate, but you gave us that flexibility to do that. Had you not have done that, the transaction would not have been able to occur because of the increase in interest rates. The funds that were approved have been sent to PERS to establish a side account for the full actuarial unfunded liability. We're still waiting for confirmation from PERS with the reduced rates, but we do expect that to happen in the next few days. We anticipate the rate credit as of July 1st of this year. So really positive news, I would say, and great job. I know that it was for the board a lot of sort of question and speculation about how do we give you some options and direction, but make sure that we're protecting the taxpayers ultimately. And I think you struck a really solid balance there. Finally, I just wanted to share some more good news that we were successfully able to place our staff in the Human Services Division, able to place all the residents of the university in shelter that were being sheltered due to risk of COVID with FEMA funds by an incredible effort of our staff and a number of community partners. As of June 30th, all 45 households who were deemed at risk of COVID and were residing at the University Inn shelter have transitioned to Bridges on Broadway, Motel 66, or resolved their homelessness through permanent housing. All 8 residents of the Carry It Forward Garden Spot shelter have transitioned to what we call the Bob, Bridges on Broadway, or to Shelter Care's COVID shelter program. In addition, 23 Square One Villages Pallet Shelters program households have secured alternative shelter or permanent options. Incredible partners that assisted in this work: Carry It Forward, Square One Villages, Homes for Good, Shelter Care, St. Vincent de Paul. Gratitude also to our county staff in human services, James Ewell, Maria Cortez, Danielle Bautista, Jamie Lusk, Aaron Palmer, Katie Winiger, Brianna Vincent, Craig Wilson, and PK Kerr, in addition to Kate Budd, of course. Great job by all of our staff and community partners to get all of those individuals transitioned, and really pleased to hear that many folks have been, their homelessness has been resolved and they're moved to more permanent shelter. I will also share that we have ongoing bi-weekly case conferencing calls that will continue to transition as many residents of the Bob and Motel 66 into permanent housing as possible. This is just an example of what is going on daily in our system that we oftentimes don't talk about, is the really intensive work of our staff in human services, oftentimes of our partners in the cities and with our nonprofit partners, to make sure that we're getting people sheltered and then getting them transitioned into more permanent situations. So thanks. I know that was a very lengthy number of updates, but appreciate the board's attention on those items.
All good stuff. Thank you, Ms. Morgaski. Any responses from the board? I'm seeing none. We'll move along then with the agenda. County Council has no announcements today, I've been told. And moving on to Commissioner Business. Any announcements from the board? Commissioner Buck.
I have had the privilege of going to lots of events this summer so far. Yesterday, my daughter and I were able to visit the Oregon Country Fair, and it went swimmingly, although very crowded. But I hadn't been there since I was in my 20s, and my daughter had never been. So it was quite the experience, and it went fantastic. And of course, there's events coming up. I wanted to note one in particular, which is Bohemian Mining Days in Cottage Grove, starting on Thursday and running through the weekend. So if anybody's interested, please head on down to Cottage Grove and have some fun.
And run the half marathon.
Yeah.
Excellent. Thank you, Commissioner Buck. Any further announcements from the board? I see none. Any future board assignment requests? Commissioner Buck.
Thank you, Chair. So I've been following some pretty interesting developments at the International Port of Coos Bay. When President Biden signed the bipartisan infrastructure law in November of last year, one element of that act was a program to fund major projects that are too large or complex for any traditional funding methods. And they are now pretty much referred to as mega projects. The port submitted a mega application in early June in hopes of receiving some notification this upcoming September. If successful, it would dedicate funding into a project that would create a container terminal and significant upgrades to the railroads that are, by the way, mostly in Lane County. I think it's really important for us to better understand the implications of that particular grant. While the railroad is mostly in West Lane district, there is an existing reload facility that happens to be in my district and within the Eugene city limits that I recently was able to tour. And as a result of that tour, I think it would be really important to engage with the city of Eugene on several fronts, but I would like to ask for a work session for them to come and present about this project and better understand the implications of the railroad, the traffic, the jobs, and any issues that we may need to review or discuss with the city of Eugene.
You have my head nod on that. Looks like your concurrence across the board on that.
Great.
Hope it involves a discussion of passenger rail to the coast. That's way down the right road. Very good, thank you. Then, Ms. Mokraski, I have a request, and I'm just asking for a report. I don't believe we need a work session at this point in time, maybe subsequent to this, but I'd like to, we know that the Glenwood transfer site, the solid waste transfer site, ultimately is going to be decommissioned. We're not sure exactly when, we're not sure exactly what it would take, but what I'd like to ask for is a report on the process, the timeline, and the cost of decommissioning the facility. I'm not asking for a great deal of staff time because I think much of this work has been done already, and it comes at the interest of a number of entities, not the least of which is the city of Springfield, which the transfer site is located inside of the UGB of the city of Springfield, and really. Significantly, Mr. Mokraski, that chunk of land inside the metropolitan area that Lane County owns probably has a higher and better use than it's being placed into at this point in time. So if just a report on what would the process be, what would the timeline approximately be, and what would it cost, including the downstream effect of how do we handle solid waste should we decommission that facility. So ask for a head nods on that. Okay.
Go ahead, may I?
Please, Dr.
Sorry, Commissioner. This actually relates to what Commissioner Farr was discussing. I also, if you recall, I worked with Mr. Mokraski and invited gentlemen from bulk handling to present to this body, and it was exceptionally well received. And as a result, I know that Public Works is issuing an RFP for a part of what was being discussed, both industrial recycling and reselling of throwaways to recycled markets, as well as organic waste to energy, which also will probably serve to naturally locate some services that are probably in the transfer station now to Short Mountain. So I just want to, in shaking my head, say I think it's timely just to get all that information out so people can work with it. Thank you, Chair.
Thank you, Commissioner. Commissioner Bozich.
Thank you. So I have two items.
Did we get the head nods?
I think there were universal concurrence on that. All right. Thanks.
All right. I skipped over that. So I have two items I'd like, and the first one kind of builds on the discussion of solid waste somewhat, which is I'd like to get a report back from LMD and Environmental Health on this year's Oregon Country Fair. There's a significant issue with basically a medieval midden heap that was placed adjacent to properties for, quote, food composting. And I think we need to either review our rules around food composting, whether it can be done in the open on the ground, or whether it needs to be contained in a building where it can be kept, vermin can be kept away like coyotes and other things. And then the secondary to that, once again, we had, I don't know which campground because it's always hard to tell, but it always seems like the first night the campgrounds are open, somebody runs a concert past 11 o'clock. And I hear from a lot of neighbors, and they seem to do it that first night because it's kind of like, oh, we can just say we kind of forgot the rules or something like that. Or once they get reminded, they're good the rest of the weekend. But how can we prevent that next year? Why does it always have to be reactionary versus, kind of letting these campgrounds know you're operating by a permit, which we have the expectation that you're going to follow county code, including the noise ordinance, which means, stage is shut down at 11. And I'm the one that gets all those calls, and not to mention, once again, cell service stunk that whole weekend. And in fact, even internet service bogged down out there. Spectrum actually bogged down. And I've got a fiber connection and we were having difficulties with our Spectrum service. I will say though that on that particular issue, the OCF has done everything they can. Verizon's been the issue. They just don't want to participate in a solution. It seems like they just don't care. For 3 days, their customers get taken off there. Yeah, they just don't seem to care. Although they did something this year that I at least was getting text but I'd like to kind of be an after action maybe sometime when staff has had a chance to look at that, and particularly that issue of food composting and waste disposal on those EFU lands adjacent to a lot of RR land. We got head nods on that
Yeah,
one?
that's an after action report on those
Yeah.
two items. Yeah.
Then my other item I'd like to get is and this may have to be exec session. I'm not sure the board is aware of the issue around several parcels that were created due to basically fraud and document invention. And unfortunately, there are two families that are now being punished because they bought those county approved, county permitted homes. And now they're being told that their homes no longer have permits and that their parcels don't even exist, so to speak. I would like to get an update. It may have to be an executive session because of the nature of this, with options from staff about what we can do to prevent the victims of the fraud being victimized a second time by us removing all their permissions to live in existing housing. That, you know, if we continue with the direction staff has taken from LMD, would have to be torn down in the middle of the housing crisis, and two families will become homeless and lose all of their investment. So, and I think it's important. I don't know if the board's aware of it and understand it, but I think the board needs to know about this, and if there's board action that can be taken to make things right for these families. Yeah.
Thank you, Commissioner Bozovich. I have heard about it, and I would concur with board action to be taken specifically for this instance.
Yeah, not to be blanket in this instance. And yeah,
Commissioner Bernie.
I have heard of it, and I think executive session would probably be the appropriate.
I was trying to be as general as I could,
then
because I do think it may have some legal implications.
Excellent. Then Ms. Mokrowski, we'll put that on your list of assignments, but we do have an executive session scheduled for afternoon next week. If it could be brought back that soon. Vice Chair Trigger.
Thank you, Chair. I just want to clarify what we're giving head nods to is having an executive session to explore this issue and get more background, not necessarily to say, and the board will take action to remedy. I just want to make that really clear, because we can't do that in executive session, and we can't say we want to hold an executive session to do that. Thank you.
Very good. Okay. Any further future assignment requests? Then we will second. We'll move along to review of assignments. Mr. Mokrowski.
Okay, so I did have the assignment from item 7B to monitor and report, and I think we'll add that as an assignment. The staff will monitor and report back, LMD staff in particular, as well as legislative affairs staff, on the rulemaking and any potential impacts related to Measure 109 implementation. The second request from Commissioner Buck, I missed who the presentation was from, but a presentation regarding the Coos Bay Railway project from
Alex Schuyler will most likely have the correct parties to bring to the table to present. Yeah, some representatives from the project.
Got it. We'll assign it to Alex. Commissioner Farr's request to report back on the Glenwood transfer site regarding process timeline and cost. I will note on that, Commissioner Farr gave me a heads up on this, and I talked to Dan Hurley, our Public Works Director, who indicated that our staff is actually just beginning the process now of going out and doing a detailed analysis. It wasn't anticipated that would be done by the end of the third quarter of this year. But I think that detailed analysis would include much more information and detail than you're requesting, which is sort of just generally speaking. So I think we can report back over the course of the next few months with what you're requesting around process timeline and cost. And then Commissioner Bozovich's two requests. One, an after action report on the Oregon Country Fair regarding food composting, as well as concerts, campground concerts. We'll include LMD staff and any other appropriate staff as needed there. And then a potentially executive session regarding legal issues on illegal parcels. I think that's enough for now.
Very good. Anything further other than instructions to you to, if you can, climb the second highest mountain in Washington State sometime in the next quarter?
Goal.
Then with that, we will have no afternoon session of the Board of County Commissioners. Our next regularly scheduled meeting is July 19th at 9 a.m. We are adjourned.